Welcome everyone to the 2020 Captain Summit. We are so thrilled that you're all here today. There's over 400 of you. Welcome. I'm Ann England and I am the co-coordinator of Captain.
And I'm Patty Shetter, co-coordinator of Captain on behalf of the Captain leadership team. Welcome to our 2020 Captain Summit.
Can you believe this is our 8th year? So everybody give yourself some clapping and cheers. We have done nothing but grow and grow and grow, and it's all thanks to all of your efforts to implement evidence-based practices for autism. So there's a few things. This will be more important in your job-alike breakout groups, but think about renaming your Zoom with your first name and your last initial and your Captain region. Keep your cameras on, and again, this would be more relevant when you do your job-alike breakout groups. Take advantage of today you've set aside, try to be present and engaged. We have so much information for you, literally hot off the presses. Listen deeply, think about those students and children and individuals and families affected by autism, and have fun. Don't forget that we have a link to all the summit materials. So every single thing that you're going to see today is available to you in the Google Drive.
We are pleased to be able to offer continuing education units for speech language pathologists, for licensed psychologists, MFTs, LCSWs, as well as for BCBAs. There are a few requirements though for qualifying for the continuing education units. Because this is a webinar, we are keeping track of attendance and participation by the number of minutes that you're on the Zoom link. So please make sure that you stay logged on. If you do have any issues, because we know technology can be a problem sometimes, go ahead and just send us an email if you're having any kind of technology issues, and we'll make note of it. But please do maintain your connection as best as you can and participate when you're able to. And during the job-alikes, we do request that you participate by having your cameras on and participating in all of the activities. The BCBA, all of the units will be issued to you within a couple of weeks following the summit. You'll receive an email with your certificate. And you did register for these when you registered for the webinar. So if you feel like you didn't click the right button, or if you're concerned at all, just send us an email and we'll confirm that you in fact registered for those continuing education units.
Good morning, everyone. I'm here to talk about how to be social despite our summit being virtual. So although we are not physically together this year, we can still showcase the Captain Spirit on Instagram. So please send us photos of yourself throughout the day. Maybe while you're listening to the keynote, you could take a picture of yourself with your pet or your child, or both your pet and child together. If you can show us your desk, your backyard, or your closet, if that's your hiding spot from your children while you're attending the summit. So tag us at Captain_EBPs on Instagram, or use the hashtag Captain Summit 2020. Also, if your account is private, but you want to be featured, you could just send a DM at Captain_EBPs. So looking forward to posting your pictures. Have a good summit, everyone.
So the agenda, we all need schedules, right? So the first thing we're going to be doing is having our keynote from 8:30 to 10:10. And then you're going to get a break. Isn't it good to know what's happening? And then you'll come back and it will be the famous hot topics and year in review. Then, yes, we're going to give you guys all a lunch break from 11:45 to 12:30. And then after lunch, this is where it gets a little tricky, so listen carefully. At 12:30 to 2, the Job Alike Family Support, you're going to use your special link that's on the agenda and go have your own event for the family support agencies. At the same time, the Job Alike Regional Center cadre, you'll all use your special link that's on the agenda and you'll have your special event in the afternoon. Schools, you all come right back here on this same webinar link, and we will be doing a presentation for you that's related to the school's Job Alike. It will be after that, so that's 12:30 to 1, and then at 1:10, you're going to go into your Job Alike Captain Region breakouts. But first, after lunch, just come right back here on this link, and we're going to have some more information to help guide the discussion groups in your Captain Regions.
So on to the theme of this year's summit. We selected the ABCs of implementation as our theme for this year for multiple reasons. One is that it was made really clear in the new NCAPE report that the evidence-based practices, while incredibly important, can only really be useful if they're implemented and implemented well. And as all of you know, implementation can be the tricky part of the work that we do, trying to get the adults that we work with to engage in the behaviors of implementing these practices and supporting these practices at all levels, at a level that allows them to be implemented so that our students and our clients and the adults that we support can receive some benefit. So our theme for this year is the ABCs of implementation, and we're just thrilled to have Dr. Clay Cook here to present our keynote for this year. Many of you may know Dr. Cook from his years as the research director with Pent. And while he is a Northern California native, he's now at the University of Minnesota and is a professor and a core faculty in the Institute of Translational Research in Children's Mental Health. Clay's research primarily focuses on the development, evaluation, and implementation of evidence-based practices to improve youth access to social, emotional, and behavioral supports in schools. But he also has an interest in implementation science and the investigation of the factors and strategies that impact the successful uptake and delivery of sustainable evidence-based practices as part of school-based service delivery. We're really thrilled to have Dr. Cook here as our keynote speaker for this year's Captain Summit to help us really continue to learn about implementation science and how to best get these evidence-based practices for students with autism happening in schools and in the community. Thank you, Dr. Cook.
Thanks, Patty. It's really an honor and privilege to be with you all. Captain, and those of you that are affiliated with it, you are a national model. We all exist within a bubble, and sometimes it's hard to get outside of the bubbles we exist within and recognize the type of work that we're doing and have a full appreciation of that work. And I wish you could better understand the national landscape as it relates to the translation of evidence-based practices for students with autism spectrum disorder. I think you would all take a huge sense of pride in what you're doing, why you're convening here, and how you're actually working as a group to improve the lives of kids and families. So I just want to shout that out right at the outset. You all have to get your act together, and with commitment and continued efforts, more kids are going to access what they need. When more kids on the spectrum access what they need, you're going to radically change outcomes for kids in the state of California, and you'll influence what other states are doing because people are watching. So I wanted to just introduce myself a little bit more about, I think, some interesting tidbits. You know, I grew up on a farm in Northern California in the town of Escalon. My dad's a high school dropout. He's 50% Native American. His mother, my grandmother, moved from Oklahoma to California, and my dad was in and out of the foster care system. I ended up in alternative education in high school for a stint, and it was really sports that kept me involved. I went through graduate training at UC Riverside in California, And that was the first contact I had with evidence-based practices. I started to recognize that we have a wealth of information about what works. What we're failing to see is what works bring themselves to life in everyday environments in which kids naturally exist. And schools are a primary place where kids naturally exist, so it's an ideal access point. And it was at that point I became motivated. What we really have here is an implementation gap that needs to be addressed through thoughtful, well-intended efforts. And I really do see you all as a organization that is committed to translation and building the capacity to influence systems that influence the adults within those systems so they can more consistently adopt and deliver known effective practices for kids. In the area of implementation, whether it's in healthcare or whether it's in school settings, everything boils down to quality care that people access. And so this is an effort to really try to make sure the things we know can work get actually received. I was thinking about a funny way of opening this up, and I was going to use some memes or some different approaches, but then I thought, you know what? People are kind of stressed and burned out and currently, given everything that's happening. I thought, well, baby animals might be, just looking at baby animals. Who's going to be upset when you look at baby animals? So that was my substitute. And I was like, oh, look at this cute little porcupine. But things turned on me quickly. Who doesn't like a little baby sloth? Who's going to feel upset about those things? And then for dog lovers, anytime you see kind of a puppy, you can just kind of melt away. But what happened while I was looking for cute baby animal pictures, I started coming across ugly baby animals. And I mean, like, what is this? And then I came across an even uglier baby animal. It's like only the pet owner would love this animal, maybe. And then uglier ones, and yet even uglier baby animals. So that's my attempt to try to launch this off. I hope that from an implementation perspective, we're going to cut to the chase pretty quickly around adult behavior. Many of the adults aren't doing well. Unwell adults aren't the best implementers, and they're not consistent implementers. And if we're not attending to the wellness and well-being of the adults, because the adults are the catalysts that drive all the practices that kids end up getting received. And if we don't do things that intentionally promote the adults to be socially, emotionally well, our work has indicated they're not very good implementers. Stressed and burned out people aren't necessarily open to taking on new things, and we have to attend to that in the process. My plan is going to be simple and straightforward. I'm going to preach to the choir, to you all, why implementation is important, give you kind of my perspective on the language for why we have to improve implementation literacy in schools. Schools are by and large an implementation illiterate environment we're functioning within. And I mean that respectfully. Think about literacy in general. We need people, leaders who have implementation knowledge and can apply that knowledge in everyday implementation practice. And so we have to come up with very skillful ways to convince people why implementation is so critical to everything. And we have to increase the overall implementation literacy of people who are in charge of budgets and decisions at higher levels so we can create the realities for implementation to actually happen, so we can make it happen. And then I'm going to just appeal to you all. Hopefully you see yourselves as systems change agents, not just individual providers, whatever role, but you are change agents that can actually facilitate the implementation of evidence-based practices so more kids are able to access higher quality care that moves the needle on really important and relevant outcomes. So that's my simple task and how I'm going to lay it out. I believe there's these educational tattoos. Like if I could, and I was in charge of the whole system, any person who wants to go into education, you'd have to get the tattoo. They wouldn't look cool. You wouldn't go brag about them, but they'd be super functional. This is one of the educational tattoos I would have people get either on their neck or their bicep or some other place on their body. The reason why, this is a model to live by. Anytime we want to do work in schools, we need to start with the outcomes. What are the precise outcomes we want to achieve? And outcomes are what we want to achieve and produce as a result of what we do. Now, many systems focus on the outcomes and they don't pay close enough attention to identifying the specific high quality practices that, if implemented well, will achieve those specific outcomes of interest. So think about children on the spectrum. What are the outcomes you want to achieve as a result of what you do? The next thing we have to do is identify the effective practices that, if we put in place, will actually move the needle on those outcomes. But that's not enough. The next question we have to ask once we have the effective practices are, what are the systems of support we need to get in place to support the adults to deliver the effective practices? That's why creating lists of evidence-based practices alone ain't going to move the needle on outcomes, because we fail to pay attention to the systems that we have to put in place to support the adults to put in place the effective practices. And those are the things the kids receive. So I look at it, there's twofold. There's the student-facing practices. They better be good if they're going to move the needle on kid outcomes. But then there's the adult-facing systems we have to create that enable the adults to put in place those student-facing practices. And we need good data. If we don't have data on both implementation and student outcomes, we're going to be really hindered in our ability to make timely and relevant strategic decisions as part of a continuous improvement process. And that's what we're trying to do. We're simultaneously trying to continuously improve implementation, because if kids access higher quality of care, that's how we simultaneously improve student outcomes. And so this is a model to live by in any area of your work. You got to define what the outcomes are, select the identified practices that can actually change those outcomes. What are the systems of support that we need to wrap around the adults so they can deliver those practices? And now, once we initiate that, we have to have good data at our fingertips to make decisions as part of a continuous improvement process. So I want to launch us out there, just get some implementation juices flowing. I honestly believe we actually created fake tattoos of this and we're handing them out in one of the trainings we did. I honestly, if you don't want to look cool, you want to be functional, consider getting this tattoo. Many of you have heard statements like this. Here's the inconvenient truth. Students with ASD cannot benefit from ineffective things implemented well, or effective things that they do not receive. There it is. It's that simple. If you implement something super good and it's a rotten intervention, it ain't going to benefit the person. And we have issues where things are being implemented well, they're just ineffective. And then we also have issues where effective things kind of exist, at least on paper, implementation scripts in an intranet, or maybe there was a one-time training and people are aware of it, but they're ultimately not received because they're not implemented. So in the chat, if you can, where do the systems you work with struggle? Which of these issues do they really struggle with in actual practice? Is it the fact that you see people invest a lot of time and energy into ineffective things? Or do you see people talking about effective things, but ultimately kids aren't receiving them because they're not being implemented well? I'm seeing lots of boths, but I'm also seeing poor implementation. People's awareness and knowledge of effective things are there, but awareness and knowledge alone ain't going to drive behavior. It's called the intention to behavior gap, and we're going to get into this later on. How do we resolve this intention to behavior gap, where people have good intentions to do good stuff for kids, but ultimately they're not following through with the behavior, so kids don't consistently access that? I'm seeing all kinds of good stuff in the chat. All talk, no action. I mean, the lip service part is where we're trying to align people's, because when people are talking about it, it usually connotates some type of value, but their behaviors are discrepant from their value, which is natural in any phase of life. How do we align people's behavior more with their value systems to get in place those known effective practices in ways that can really make a difference for kids? So many of you have seen this. I should have put, this would have been educational tattoo number 2. Get this somewhere on your body, or just maybe just don't, just commit it to memory too. But this is the formula for success. You have to have an effective thing. We have some of us who are implementation researchers. We have a colleague, Jeff Curran, who calls evidence-based practices things. We have things. We got to select good things. Things are stuff we put in place that get received by kids or whoever the service recipient. But just knowing the effective thing ain't gonna change the outcome because you have to effectively implement the thing. No duh. But anytime, if there's a 0 for any one of these terms, that you automatically can't change the outcome. Because if you select the effective thing, great, you better implement it well. But the context in which we're doing implementation is sometimes so unhealthy that the adults don't get along. There's no transparency and communication. It's an unhealthy adult environment for the adults, and it works against the grain to get to consistent, durable implementation. And ultimately, we don't move the needle on outcomes. So if any one of these are 0, a school system's ability to achieve desired outcomes for students with autism spectrum disorders is going to be compromised. Now imagine systems that select ineffective things at the outset. They go all in on it. They, do a Mercedes-Benz version type of an implementation support, lots of training, lots of coaching, feedback, fidelity audits and feedback systems. They're going all in, but the thing was ineffective. And you see systems go all in based on things that have been marketed to them with no specific criteria to vet and select good, effective things. And I mean, an effective thing has to be an affordable thing. How many of you have been a part of a system where it is an evidence-based strategy or program? The system gets a grant to be able to buy that program or practice, but that grant dries up and they can't devote a line item to that thing. And all of a sudden they can't sustain that thing. So an effective thing is not only one that there's evidence that it works if we get it in place, it's something that we can stick around. We can afford it over time, and we can dedicate a line item to keep it going. And it also has to be feasible given everything else people are asked to do. So we have to have criteria to select those good things. Now, effective implementation, one way we think about it is the deliberate effects of our implementation efforts. These are the outcomes of our deliberate and intentional efforts to get something in place. And the common language we adopt around those outcomes are adoption. Imagine you get weak adoption. You provide training and you're trying to initiate people doing the thing, but the proportion of people who start doing the thing is low. That already puts a cap on what you can achieve with regard to fidelity and reach. Fidelity is getting people to not just start to do it, but do it in the way it's shown to be effective. So it increases the probability that the child will receive it in a way that could be beneficial to them. Now the reach is, of the people who should get it, how many of them are actually getting it? We see a lot of practice have a limited reach because if few people adopt, few people get to fidelity, that means the reach of that practice is small. And then if you have issues around that, to be able to sustain good work is really hard in many systems. And we have to be very intentional about that sustainment issue. We got to plan for sustainment at the beginning. What makes sustainment hard? If you can, in the chat function, why do systems struggle to be able to sustain good work? They were able to lift off the ground, get going, and get people to fidelity. But ultimately, if you came back 5 years from now, there wouldn't be a whole lot of semblance of that work that persists in the system. What's getting in the way there? Turnover, I mean, this stability. If you have an unstable workforce, it already works against stability. Because that's what sustainment is. It's stable continuation of something, a known effective thing, once we start to withdraw some supports. So we have to have really good onboarding and induction processes to combat that. So anytime we have a barrier that's like a torpedo that can sink an important implementation outcome, we have to develop a plan to strategize and prepare for those things. And there are things that we know are going to come up with a high degree of certainty. And so we can, develop those plans with those things in mind. And those are proactive implementation plans. So we know effective implementation gets defined by the outcomes we're able to produce as a result of what we do. Now, things are programs, practices, procedures, products, policies, and processes. They're P's. Things have implications for adult behavior. Like you're going to be altering how you behave in a very certain way, because if you behave like that, kids are going to get higher quality experiences and supports. And if they access those higher quality experiences and supports consistently, that's what will change specific outcomes, like social skills, communication, language, academics, emotion regulation, depending on what area of outcome we're really focusing on. Now, we have things. You all have nice blueprints that outline lists of known effective things. And the last count was how much? Patty or Ann, what was the last count of how many evidence-based kind of standalone practices are we looking at?
28.
28. I was about to say 24, so I'm glad I asked the question and just seemed like, but now I'm showing that I thought it was 24. But you have 28 known effective things. And obviously those practices get tailored and adapted to kids based on the needs that they're exhibiting. It's not like you would kitchen sink a kid and let's do all 28. Some might have some overlap and redundancy, but there's effective things, a whole list of effective things that research has shown to us that if we can get in place, it can make a difference to achieve certain types of outcomes we want for kids. Now, implementation science, the way I look at it, it's the process of developing and testing methods and strategies to get things in place. So it's the whole process of learning how do we get things in place so they're received by kids. And we're trying to figure out that. What type of leadership, what do leaders engage in terms of their behavior? What does the climate of the school around implementation need to be? How do we address attitudes and beliefs among the people who are expected to implement so they have more buy-in and they're more willing to invest in the process of starting and getting good at delivering something? That's what the science of implementation is focused on. Now, the whole goal of science is to translate it into practice. So implementation has both a science component to it and a practice component. We need people like you who are well situated to be change agents to translate the science of implementation into everyday implementation practice, because we exist in systems with limited implementation literacy. And so we need people who are essentially conduits to get this information to others and used in very strategic ways so we can actually get the practices in place. And the network that you all have are so well positioned to do that across the state and collaborate with one another around what are the barriers, how do we overcome barriers in this process. So just keep consuming this science of implementation, because largely what the science is trying to do is produce generalizable knowledge that gets used by people like you. Here's how I think about it. We have an effective thing. It's like a relay race. This comes from Jeff Curran too. And so we have this handoff. We have an effective thing that research has identified could be a difference maker for kids. But then we have the science and practice piece, and we have to hand it off. Like, okay, practice, we publish it in the journal. The findings should just crawl out of the journal and bring themselves to life, right? Researchers are horrible about the translational piece. And so we have to be intentional to create this bridge, because what happens is the research, the science doesn't make its way into everyday practice. And that's the gap we're trying to address. And many of us know that it just as the science to practice gap or the implementation gap. So how well the thing gets implemented. I just want to give you some real numbers. Imagine there's staff who receive training, 20 people receive training, and only 10 start adopting it after receiving training. So you already have a limit on what you can achieve as a result of that. Out of the 20 staff, only 5 out of 10 actually reach fidelity on the thing. So now we got 1/4 of the people who actually got to fidelity. Now the reach means only 25% of the students who need it actually get it. Out of all the kids who need it, only 25% are actually getting it. And then we find in sustainment, only 2 out of the 5 who actually got to fidelity actually continue doing it. We call it the leaky pipeline, but that was more in reference to how long it takes research to get into practice. We also have a leaky pipeline when it comes to implementation outcomes, because if you don't get enough of the people to start adopting it, you already put limitations on fidelity and reach and sustainment. So how do we get people in this critical juncture from they're not doing it to doing it? How do we get the vast majority of people to start doing it? That's a question. For people who are steeped in behavior change, it's the same thing with regard to a kid. The kid's not doing a behavior and we need to get them to do it. How do we develop a plan to encourage and motivate them to do it? We have to apply that same lens to adult behavior. So I want you in the chat function. I can't find a profession where fidelity doesn't matter. So I want you to just select a profession and describe why fidelity matters to that profession. We've done some cross-sector, different implementation places and disciplines. And we asked people their thoughts about the word fidelity, and educators more than any other subgroup react negatively to the word fidelity than compared to nurses or community-based mental health providers. Other implementer groups, educators react more negatively to the word fidelity than other subgroups. Medical professionals, dire consequences, engineering safety, pilot safety, musicians, being able to coordinate and actually make something that sounds better than a middle school orchestra. I grew up on a farm. Fidelity, my dad, in a farm, we owned 12 acres, like a whopping farm. But my dad had issues with fidelity, and he just learned because he retired. Some other company can farm his land. He could make the same amount of money and pay them off so he doesn't have to do it because they just get better at fidelity and can produce a higher yield crop. And my dad had issues with fidelity that was limiting the yield he was producing. So we know fidelity is an outcomes-driven process. So we're trying to stay focused. What is our outcome? What do we need to maintain fidelity to? And what I think is important for us is to embrace the idea that implementation is both an art and a science. The science part comes down to the things, the known effective practices we need to try to adhere to. And the art part means bring into life those known effective practices in creative, engaging, developmentally appropriate, culturally responsive ways so they're better received. And that's where people are being their autonomous creative self to bring to life specific known effective things. The science gives us, hey, here are the things that matter that could make a difference. And the artistic part, the creative part is how do we actually bring those to life in a super creative and engaging way so kids are responsive to it when we're actually doing it. One dimension of fidelity is called quality or competency, not just adherence. Check off, am I doing it? But am I doing it in a quality and competent way? Now that's to me a little bit of the black box. You kind of know it when you see it and it's done super competently because the person's enthusiastic, they add their own flair to it, they've embellished some parts of it to make it more creative and the examples work better, or they've considered the kids' unique needs and they've adapted things while maintaining fidelity. So when we think about fidelity, this is what we're trying to do. I look at fidelity as just behavior change. It's a substitute for behavior change. We're trying to alter behavior among adults in ways that lead to kids receiving higher quality experiences and supports. So we have two gaps. We have the access gap. Many kids never access the supports they need. So that's an issue. And then we have a lot of inequities around there. That's a whole nother topic for a captain to take on, is really some of the social inequities that continue to exist for certain subgroups that prevent even accessing care. But just accessing crummy stuff isn't going to solve the problem. So A lot of systems count and do bean counting, like more kids are getting services. I operate a lot in the area of school mental health, where systems like to celebrate. We got more kids who are receiving mental health services by a co-located person. But when you go look at the quality of those services, it's like sand tray therapy. Like we're going to sand tray therapy a kid out of trauma, for example. And we see this, it's not only about accessing, it's about the accessing quality services. And that's where the evidence-based part of that comes in. We don't just want to increase access because we're not going to change outcomes unless what they access is good. And how do we know? Can we all check our egos at the door? How do we know what we're delivering is good? What is an objective and defensible way we can make those determinations so we're confident if we get it in place, it can make a difference in terms of kid outcomes? So I want to just open this up. We're talking about implementation, but what is implementation? What is your definition of implementation? Doing it? I like that. Yeah. Let's not mince words. I mean, just like, let's say what it is. Fidelity, following through. Designated procedures, putting the thing into practice. The thing, you use the thing language. Putting into practice, doing what you have to do to affect change. Walking the talk, yeah. Oversight, implementation fidelity checks. Those are supports and systems we create that help adults follow through. We often separate dissemination from implementation. Dissemination is a process of purposely and intentionally spreading information to a target group to increase their awareness and knowledge and motivation to want to do a thing. So where dissemination ends, implementation takes off. Implementation is more about the follow through and the enactment of putting in place the practices so they're received. So many systems rush to implementation, but they haven't done a good enough dissemination job to increase awareness, knowledge, and motivation to want to do those things. And then implementation is more about the process. Okay, once you got a properly motivated workforce, how do we actually help them follow through and enact it? And so when we think about implementation, it really is about what it's the process we're wrapping around the adults. It's not the effective thing. It's the process. So there's a couple of key terms. I've color coded this. A process, so it's not a one-time event. Putting systems in place to support adult behavior change. The question is, what are the systems that we can put in place that support adult behavior change? And it involves the delivery of a practice that has known dimensions. So a process, we know there's a phase to implementation, pre-implementation. Depending on the implementation framework, we have too many of them. There's over, I think they've estimated 100 implementation frameworks people have developed. It's silly at this point, but most of them that are process frameworks have similar implementation stages or phases. We have an exploration phase. We're trying to identify what the problem is that warrants change, and we're going to make a selection decision on what's the effective practice. Then we got to prepare the system. That's like readiness. We got to create readiness. Up to 80% of implementation efforts fail due to lack of readiness. You're just moving through, and the people in the organization weren't ready to take it on. And you started training, you're putting pressure on people to do it, but we didn't have the readiness pieces in place. Then there's actual implementation where people are adopting, trying to get to fidelity, getting the reach. And then we have the phase of sustainment. One thing I want to be clear about is this idea of known dimensions. If people are not clear and concrete in their understanding about the behaviors they need to perform to put in place a practice, you're going to have issues with implementation. People can't follow through with something that's unclear and ambiguous. Hey, can you do this one unclear and ambiguous thing? What are people's reaction when it's unclear and ambiguous? Like you say something like, hey, build healthy relationships with a kid. And what's the adult going to say? I'm doing it. I'm pretty stinking good too, if you ask me. But if you said something very concrete, are you doing it with this behavior, at this regularity, and this, then it's a different story. Because you can't give someone feedback about something that's unclear and ambiguous. So the entire implementation process breaks down if we can't figure out and break down the practices into these known dimensions. And that means the behaviors that the adult is to engage in are clear, observable, and measurable. It's just like with students, and we have behavior intervention plans. We need to identify very clear, observable, and measurable behaviors that we're going to teach the kid. Or else the kid's not going to concretely understand what we expect of them, when to do it, and what it looks like to do it when confronted with certain kind of antecedent situations or environmental situations. So this is clear as mud, isn't it? It's just like, here's a framework. Now I'm going to hopefully, they need to work on the graphic to make it look better, but it really is an important one. This is called the Consolidated Framework for Implementation Research. What it says is there's people who are involved in implementation, okay? Think about, there is a designated implementer. When the rubber hits the road, they are the ones who are supposed to engage in the behavior because they're the ones interfacing with the kid. Now, those people are embedded within environments, and that's called the inner setting. It's like the microsystem where implementation happens. That's where the implementers are, and that's where the kids are. And so the factors of that immediate environment have the most influence on the implementer behavior. So we need to figure out what factors then matter and who do we need to work with to create a really supportive inner setting that supports implementation. Outer setting factors are things beyond the building where implementation is taking place, but nonetheless have an influence, like broader policy, leadership structures, financing. And then we have these interventions. There is no implementation without adaptation. All implementation involves some form of adaptation because you have this kind of intervention, the thing that was communicated to us in a document with very prescribed language on what it looks like. And then there's the realities of getting that in place. So all implementation involves some degree to adapt to the context and the people who the practice is supposed to benefit. So when we think about this, we look at what are the factors among the people who are expected to implement that would facilitate or get in the way? What are the characteristics of the school environment that are either going to facilitate or get in the way of the people being able to implement? And that's where we start to strategize and develop plans that support implementation of known effective things. And lack of attention to these various levels of influence is going to sink well-intended, well-resourced implementation efforts. If I don't attend to the inner setting factors like leadership and the implementation climate in the building, and whether people even feel psychologically safe to admit truth about how they're doing and receive feedback, and I'm just sitting there, I just coach and train, and I'm going to do a fidelity audit and provide feedback, and I expect that to change, I'm not attending to other factors that matter. And so I use this just for us to couch ourselves. We have environments, just like kids. The environment influences their functioning. And then there's the kid, and we need to figure out what's going on with the kid so we can tailor our plans well. Same thing for the adults. We got to create tailored plans to the environment and the people to facilitate the effective things, because people are nested and embedded within a particular environment. So what do you all think is your bread and butter as a group? Like, if you can hang your hat on something as a group, what's your bread and butter? I think I could guess, because the history of you all coming about and building and becoming something worthy of recognition and celebration has been awesome to witness from the outside looking in. And I got judgments about what I think your bread and butter as a group is. And you could maybe disagree when I actually tell you what I think it is, but I'm going to just break it down to suit the presentation that I've actually developed here. I see a lot of things that touch on the edge. I think in a couple of terms, what I would say your bread and butter as a group is behavior change. You have knowledge, you have paradigms, evidence-based paradigms to think about how environments related to context and what are strategies we can do to alter aspects of the environment to get the behavior we want to see out of kids. We have behavior change, and most of us do function in kind of a change agent role where we're trying to facilitate creating healthy environments that are promotive of certain behaviors getting in place. What we need to do, we often apply that very skillfully at a kid level. We need to take the same paradigms we use to understand kids and their behavior and start applying it to adults, because it is behavior. And we are behavior change experts, and implementation boils down to adult behavior change. That's it. I look at, if you wanted me to come up with a substitute for implementation, I would just say it's adult behavior change. We're trying to change patterns of how people behave so kids receive higher quality experiences and supports that can make a difference in their outcomes. So if we can't change how people behave, kids aren't going to receive higher quality experiences and supports. Now, this is for us to dig deep here. We all want to avoid problem admiration, right? The yeah buts, or the focus on things that go beyond our control and explain why implementation can't happen. And so the extent that we externalize that control and talk about factors that we don't have control over, we're going to feel defeated. We're going to feel less empowered in the work. We need to take on a notion of internal locus of control. And so we need to use the same paradigms that give us confidence that we can make a difference, no matter how big of the need a child has, because we have things we have control over to do. We need to recognize all the things we have control over to make a difference in changing adult behavior. The same thing that when you feel confident around bringing in paradigm and working with a high needs kid and putting in solutions that can make a difference, because we have control over so many things to make a difference in kids' lives, we have the same control over things with influencing adults. Because some of us start to question that, though. We start to go over the external side of locus of control, and we start to really emphasize factors that go beyond our control, and that's the problem admiration. And we talk about all the reasons why we're not going to be successful or why we can't, instead of that internal locus of control, where the outcomes are under our control. To get in place, we can make implementation happen. We can, having that confidence. It's not going to be easy. It's not going to be straightforward, and there's going to be some unevenness. We're going to experience some success, but we have a process that we know we can chip away, and eventually we can get these implementation outcomes in place, like adoption, fidelity, reach, and sustainment. And if those things happen, we can make a difference on outcomes. So you can't make an adult do anything. That's true. Unless you want to be arrested or on TV, you can't make an adult do anything. Because you could play that out a little bit, where you try to make someone do something, like grab them. No, you're going to implement this for this kid, or else you probably don't. You want to influence the choices and the behavior through the interactions, the supports, and the experiences you create. And we can have all kinds of different things we can start to put in place that could be super influential on people's behavior as it relates to the adoption and delivery of known effective things that kids need. So I want you to go through this, and some of you maybe have gone through this example before. This is a problem, healthcare problem, that's been pointed out. An evidence-based practice is washing your hands. Now, data indicate that 33 to 50% of healthcare workers wash their hands enough to prevent staph infection and spread of other infectious diseases, for example, in a hospital setting. That's not good. What do you think what they want the number to be in terms of use of evidence-based practice? And we know over 90,000 people die every year due to something they contracted in the hospital due to poor hand washing practices. That's the estimate. So I want you to think through, based on your knowledge of behavior change, how do we address this issue? Because you have the knowledge to come in and understand this issue. You have the knowledge to come up with an initial plan and then monitor the delivery of that plan and maybe make some course corrections to start chipping away and increase the proportion of staff who actually wash their hands. And if the more staff that wash their hands, we're going to see fewer people die due to things that they never even went in the hospital due to. So what could you do to address this issue? What comes to mind? Yeah, observation first. We can go and observe the context and the people in the context and start to identify reasons that lead to the sustained lack of hand washing practices. Barriers, what's getting in the way, making it hard for people to actually follow through with the behavior? How many of you notice people have a hard time following through because of the barriers? Competing demands, things that are clunky, burdensome about things. Reminders. A lot of people need to be reminded more than they need to be retaught. We take this thing like we got to keep teaching them. No, at one point, people just need to be reminded and prompted when they're properly motivated and they understand what the behavior is. Keep training them is annoying. They know what it is. They now are having a hard time following through because of forgetfulness or competing demands. That's where the attention is. But oftentimes we train people, to a point where they just want to give up and they become unmotivated due to just repeated exposure to the content. So I just hope we can go into these situations and we can solve the problems. So whose behavior do we need to change? Well, I mean, on a broader scale, policymakers, but I don't mean just like state level or federal level policymakers. I mean local policymakers, school board members, highly influential people within the district. We got to change their behavior because they are in charge of creating policy that creates the funding and the governance around making the context for implementation happen. Now, policy alone ain't going to change behavior, but it provides the context that's conducive for the behavior change to happen. Formal leadership and informal leadership. People who have social and position power, social capital and position power. How can we help nudge their behavior so they function in ways that are more supportive of the adoption, delivery, and sustainment of known effective things that kids need? Service participants, those who are receiving the care. Sometimes we alter behavior where they start to ask for things because we've disseminated to them and now they're more aware of, knowledgeable, and motivated for their child to get things. That creates pull. And then service providers, and this is who we usually think about. Well, we have our designated implementer and we got to support them to adopt and deliver. So we have to alter their behavior because their current practice, status quo, is not providing the type of high quality experience and support the kid needs. So we have to, how do we move their behavior? So we know there's differences. We call them implementation, role-specific implementation behaviors. Like the behavior that a policymaker engages in is writing something, voting for something, writing a check for something to make something happen. That's the behavior we're trying to get out of them. We have to be very clear about what the behavior is. Formal leadership, they don't implement, but they need to prioritize. They need to message the importance. They need to align it with the other work. They got to deprioritize and take things off people's plates. Those are the behaviors that leaders perform to make implementation happen. Then obviously service providers, fidelity becomes very central into the behavior change process. So we know that there's differences in role-specific implementation behaviors. And we know that implementers or any group, there's heterogeneity among the people. And what I mean is there's variability. And some people are going to have the behaviors in place, some are not, and some are going to have different reasons why. So we have to take into account this what I call homogeneity within heterogeneity. Which are the leaders who just lack knowledge about what the practices are and how they can support them? Which of the behaviors actually possess knowledge and have know what the practices are, but they don't think it's a priority? So we start to look at the reasons why certain behaviors are. We need paradigms to explain what we're seeing. Because if you just do a one size fits all, we're going to do this with every person in every context and do the same exact thing, you're going to have an ineffective approach to implementation. What the evidence tends to suggest, the more we can create context and people-specific strategies, we tailor it to the actual things that are happening in that place and with those people, and it increases the likelihood of success. It's just like tailoring for kids who have autism. Like the more we tailor the support based on the unique needs of the kid, because children on the spectrum are a heterogeneous group of kids, and you got to find like what are the needs and then tailor the support plan to the underlying needs of the kid. And we know that everybody's human, at least we think they are. And then we got to come up with, there's underlying principles of behavior change across everybody. There's cognitive reasons why, there's emotional reasons, there's physiological reasons that underlie people's behavior, why they do what they do. And we can take those into account. So our process here is, okay, here's policymakers, we got to define the behavior we want. And who are you going after? Vote, write legislation, advocate. Service recipients, they're pulling for it. They're saying, hey, we want this, we need this. Leadership, allocate time and resources, use of other implementation strategies that support staff. And then we got service providers. Their behavior is to adopt and deliver with fidelity. Now, what we want to do is how and why does this change come about? How and why would someone engage in those behaviors? We need to understand this. And so we have to have a paradigm, because here's the next tattoo, the problem-solving model. Live by this. Seriously, live by it. Anytime you have an issue, identify and define the main problem that warrants a solution. But the magic is really step 2. Determine why the problem is happening through a root cause analysis. You need a method to engage in a root cause analysis. Why aren't we seeing the behavior? What explains why we're seeing this behavior and not the behavior that's consistent with implementation, good implementation? Then once we determine why, we can select solutions and develop a plan. Then once we have a plan, we got to create the supports that enable staff to implement the plan, to follow through with the plan, and we got to evaluate whether that worked. So anytime we have an issue, we got to identify and define the main problem of concerns and then analyze why that problem is happening. And so you have a root cause analysis. Applied behavior analysis, taking a functional behavioral approach, is a root cause analysis paradigm that explains why people are engaging in their behavior. And then what are the supports if you're going to move the behavior to a more desired behavior? Let's say that's fidelity. Then what are the supports, the setting event, the antecedent strategies, the teaching strategies, or consequent strategies we can put in place to support behavior change? And so we have, many of you are very well steeped in applied behavior analysis and can apply that paradigm, but often maybe don't use the same paradigm when we start thinking about implementation and the supports adults are going to need to move the needle on behavior. So I like to think about it in this kind of way. So a current behavior is kind of a fire. From a kid, we would say that's the problem behavior that we want to address. The current behavior means it's status quo. The person isn't following through with the behavior that would support implementation. The kid actually eventually receiving the thing. Now there's things, like we know with a fire, there's always a source for that fire that provokes it. It goes from not having a fire to having it. What's the match? What actually provokes the behavior and sets it off? And then we have lighter fluid. Lighter fluid increases the probability that if the match is struck, we're going to see that behavior. But lighter fluid alone doesn't cause the behavior. The behavior is caused when the match happens, and the behavior happens for a reason. And we need to understand what's sustaining and keeping that behavior going versus another behavior. And so we can start to understand this in terms of different people. What we want, let's imagine you try to bring to the board and you want something passed or voted on and want something, they cast a vote for non-evidence-based policy measures. And we continue to see kind of ineffective, silly things that are around IEP writing, that's more compliance driven. It's not about high quality care. It's just kind of silly stuff that doesn't make a difference. Well, they have a time and opportunity to vote for a bill. That's what provokes that behavior. But what were the setting events that increase the probability when the time to vote for a bill or a policy in the school, they were going to do that behavior? Lack of understanding, they get social expectations and pressures to do a certain thing, and that explains why you see that behavior. And the reason why they engage in that behavior, they want acceptance by others who vote the same way and whose approval they value. So we have to address, we got to create things. If we want a different behavior at the time to vote, we got to make sure that they know the options and clearly understand. So we got to pre-correct and prompt those things. We got to make sure in terms of the setting events that people have the knowledge and understanding our place. When the match gets struck, they're likely to go to the alternative behavior, which is actually voting for something of substance that can make the difference on kids receiving higher quality experiences and supports. And we got to make sure that that behavior is reinforced. Because a lot of people, there is no incentive to engage in the behavior around evidence-based practice for them. And we have a hard time getting the policies in place that can actually move the needle. So we have to think about how do we increase the reinforcing value of that behavior. So when we think about others, we have the same thing. Discuss other implementation work in the building with no mention of EBPs for students with ASD. So there's this opportunity, staff planning meeting, whoever the leader is, they don't discuss any of that. And there's an opportunity for shared protected time to engage in planning around the work, but it doesn't get done. So that leader's not engaging in the behavior that could be supportive of the adoption and delivery of effective practices for kids with ASD. Not a priority relative to other obligations. So the setting events there, they don't think it's a priority. So actually engaging that behavior doesn't have a lot of reinforcing value. Insufficient self-efficacy. Not only do they don't think they can actually facilitate the planning process around the EBP well. So as change agents, how would we address the setting events? And then what do we need to put in place at the time of the staff meeting to provoke that they would actually engage in the planning process? And then they have some type of desired outcome that comes about of it in terms of a reinforcing experience. So when we look at whoever's behavior is, what's status quo behavior? What's current behavior that's sustaining ineffective practice? What is the behavior the person needs to perform that would actually support the adoption and delivery of the effective practice? And how can we understand their needs from what are the setting events that we need to put in place that increase the probability when they actually have the opportunity to perform the behavior, they'll do the behavior. And how do we make sure that they capitalize on that opportunity and don't miss it? So what are the prompts, pre-corrections, and reminder systems that we can put in place? And do they even understand the behavior in terms of our teaching strategies? Have we helped them understand what behaviors they can perform and how they would do it? That's where people need our support from using this paradigm. Punitive public oriented approach to address behavior, the students excluded, the unwanted behavior, belief that punishments work, feeling overwhelmed due to implementation overload. They don't think they can take on the alternative practices. So it's a lot easier just to remove the kid and not have to deal with it and seclude them or keep them away from others, whatever Nowadays we've created, well, you can't do this, but then adults create still exclusionary situations that make them feel better, but it still has the purpose of depriving the kid from any type of opportunity, meaningful opportunity. And so you see the same thing, that pattern of behavior, and you have an alternative method to respond that could be healthier for the kid. How do we actually move the behavior over? Because that behavior is serving a purpose for the adult. It's a functionally relevant behavior. It's achieving a desired outcome. So when we think about this, what we're trying to do is we take kind of current behavior and we want to substitute it with role-specific implementation behavior. How do we get the behaviors we want to see in place? So we have setting event strategies, teaching strategies, and consequence strategies. Just like does the person lack understanding of what the behaviors are? Do they not have awareness and knowledge over those things? Or they're kind of weak in their sense of efficacy to follow through with that? So how do we actually use teaching strategies? What are the setting event and antecedent strategies we need to put in place that increase the probability that when provided with the opportunity to do it, they'll actually follow through with doing it? And how do we use consequence strategies on the back end, regardless of the behavior, to react to it if the person didn't do it in an effective way, or reinforce and acknowledge successive attempts to get that behavior in place? So the strategies we use can be the same strategy. The strategies we use with kids in terms of developing a plan can be the same strategies we use to develop a plan for the adults, because we have setting event strategies. What we're trying to do is increase the reinforcing value of their behavior as it relates to implementing something. So how do we do that? We have elimination strategies and neutralizing routines, the same type of stuff. Like many people, the setting event is they're overloaded and they're telling you the truth. There's so many competing demands, and there's not a human on the planet that can do everything they're being asked to do. And that is a setting event that decreases the reinforcing value of taking on a new practice and getting good at it. Until you address that setting event, you're going to have an issue. Past history with new behaviors. In the past, it's a setting event because it's clouded their judgment to new stuff in the present moment. That didn't go well and it didn't work. And so people are non-committal. They get the opportunity, and to engage in the new behavior doesn't have as much reinforcing value. And many people are just wigged and burned out. And I don't know, in many respects, this isn't true because some kids are being severely impacted by what's happening. But in many systems I'm going to, I see the adults are struggling more than the students in terms of their fatigue level and stuff. And I mean, adults who are struggling, they're burned out and crispy, are going to be harder, less open and willing to invest in adopting and delivering things. They're kind of in survival mode. So those are all setting event factors that we have to take into account, because we're assuming once we train people and provide coaching, we got like a properly motivated, well workforce who's just waiting for the opportunity to learn about something, then change their behavior. And that is a faulty assumption. Many people aren't in that place. They have lighter fluid on them, and we actually have to wash that off. And then there's the perceptions of their environment. Psychologically safe. Is this a safe place for me to take risk and put my neck out and then be judged by others? Many people exist, and you ask them their perceptions and you tell them and they tell the truth. They fear being judged, humiliated, and outed as being ineffective in their job if they struggle with something. So it's easier to play it safe and not try to and continue kind of status quo than put myself out there. People need to know that I perceive, if it's a barrier in my mind, I perceive there will be protected time for me to reflect and get better on it. If I think there isn't, I'm going to be non-committal to engage in that behavior. And that's a setting event. It's a cognitive setting event. Like, I don't think I'm going to have the time to do this. Behavior is going to be measured. I know from an accountability perspective, behavior will be measured, and I'm going to get feedback about it. I'm anticipating that. And then the consequence strategy is you actually do it. But the setting event strategy is like, I feel a sense of accountability and pressure because people are going to measure and give me feedback about doing that thing. Antecedent strategies. This assumes the person's motivated to engage in the behavior largely. Because if you're going to pre-correct and prompt them, the person has to think that there's value in the behavior. You have some setting event work to increase motivation to want to engage in the behavior. Or at least that the payoff in terms of the incentives and rewards will be worth it. Because prompts will only work if you have a properly motivated person. If you prompt someone to do something and they're not motivated to do it, they're going to look at you like, okay, get away, you're annoying. I don't want to do the thing. So we have a variety of strategies that have core assumptions that we have properly motivated people that want to invest in it. And all they need is our antecedent strategies to lay things out for it, make it a little bit easier because they want to do it, but there's things that are getting in the way. They're struggling to know when to do it. So we make it clear about the opportunities when they can do it. They haven't detailed it out. They're motivated, but the implementation planning, we start to detail out what does it look like to actually follow through that behavior in their environment. We do some what we call if-then planning. So we identify the obstacles, but that assumes someone's motivated. Like if they're going to engage in if-then planning about barriers that are making it hard for them to follow through with the behavior, that means they're motivated to want to do it. And a lot of the supports, we don't have people are properly motivated to want to take on the new behavior. So what causes, if you can in the chat function, what causes people to be insufficiently motivated to want to invest in? Because a lot of our strategies like performance-based feedback, we're going to measure fidelity and feed it back to you. That assumes someone actually wants the feedback and they want to make changes based on the information. Overwhelmed, lack of reinforcement, burnout, lack of knowledge, don't believe that it's going to work, stress and fear, they're just, avoidance behavior. No buy-in. So we can start to operationalize this piece. So I like to think we need behavior change, like what we have in terms of applied behavior analysis. Then we need motivational theories of behavior change that really get at kind of cognitively and affectively. And that's where I'm going to combine some of these theories with us to understand behavior change more holistically. So teaching strategies, ongoing dynamic training, modeling, on-demand PD modules, implementation scripts. We create opportunities for people to observe others, but they have rubrics to pick up on things. We come back and do comprehension checks. We send people to conferences. That's all increasing awareness, knowledge, and hopefully motivation to want to engage in the behaviors. Then we got to have the setting of it stuff in place, and we got to have the antecedent strategy so we increase the probability. And then when people behave, we got to be there to pounce and provide consequence strategies depending on whether they did it or didn't do it. If they didn't, then we're debriefing and course correcting. And if they did do it, then we're acknowledging, recognizing to show appreciation through our consequence strategies. So our goal for teaching strategy is aware of the behavior, knowledge about the behavior, and feeling efficacious that they can do the behavior given the current constraints they're faced with it. That's the important one. Many people are aware and knowledgeable, but they don't feel efficacious in their capability to pull it off given everything else that's going on. And that will sink. And we have to help people. Some of the times when you have a trained eye, you're like, no, you can actually, it's not as bad, it's easier, but they don't know that yet. It's a new behavior. They need to develop the same understanding you do to feel efficacious that they can pull it off given everything else that's on their plate. And that's efficacy. Lack of efficacy sinks many implementation efforts, even though people have awareness and knowledgeable about the behavior to perform. Now, consequence, I should be a T there and an S, but are more of the things we do on the back end. Right? It's just like a kid. We try to support them preventatively. We've taught some stuff, and now it's going to play out. If the kid doesn't do the behavior, we're still going to react. We're going to debrief, and we're going to problem solve. How are we going to get the behavior? And there might be a discipline thing. For a kid, On the other side, if they do the behavior, we're going to try to reinforce the heck out of it because we want to establish that pattern of responding. The same thing is with adult behavior. We're going to try to do everything we can do preventatively, teaching wise, and then adult behavior is going to play out. And then as a consequence technique, how are we going to respond in ways that increase the probability that we'll eventually get the behavior? So we turn those behavioral mistakes where the person doesn't follow through it into learning opportunities and increase the probability next time. Or we use it as a method of pouncing and celebrating the energy and effort that adults putting in to get better. So kids receive higher quality experiences and supports. And I go into a lot of environments and the adults are on lean schedules of reinforcement. Yeah, like simple praise isn't enough. Like how do we show actually authentic, deep acknowledgement and recognition so people feel truly appreciated for the energy and effort they put in to get in place a practice that kids need. And so, you know, all of us know that reinforcement is defined by its effect on behavior. And so I don't even want to use that, but we're creating experiences where adults feel deeply appreciated, that the energy and effort they put in, so it turns implementation into a reinforcing experience and increases the probability that they'll stick with it and try to get better at it. But a lot of the environments, I think many systems consultants check it off that we already do good, but we're not doing good enough on this kind of recognition acknowledgement piece. Okay, now here's a new model for some of you. I know at least one person who knows probably this model on our event here. So I want to put it in the problem solving process. Here's a different way to explain why people aren't engaging in the behavior. It's called COMB. This is like a meta theory of human behavior change, because there's actually an effort in the UK called the Human Behavior Change Initiative, where the whole goal is to distill down on all the effective behavior change strategies. There's 93 evidence-based behavior change techniques that have been shown to move the needle on adult behavior. And their claim is all the major issues we are confronted with globally in terms of climate change, systemic racism, everything boils down to behavior change. And we have many people just are ignorant about behavior change strategies. So their effort is to distill it down, come up with a model that explains behavior change. And it's as simple as this. When you don't see the behavior, it's because of insufficient capabilities. They lack understanding or competence. The opportunities, they're not really having the opportunities to be able to do the behavior. Even if you had the capabilities, if you didn't have the opportunity to do it, you can't do it. And then the last is motivation. There's some type of motivational deficit, a performance need that warrants some type of motivational enhancement strategy. So what we can do when we have this model is we can do our root cause analysis. Is it really about the person's capabilities? So how do you improve someone's capability? In the chat, how do we improve people's capabilities to be able to do something? Training and coaching, we call them the cornerstone implementation supports. They're always going to be there. We need them. They're never going to go away. The confidence piece, you know, I mean, imagine how many simulations a pilot goes through to get confident and capable. We don't take the same practice repetition-based approach in education, but we need to, because we have a proven model that works all the time. Practice and repetition build fluency in any domain. If people, you give them practice opportunities to learn about something and get incrementally better, they start becoming fluent, and not only that, confident. So we need practice opportunities, and practice opportunities come with training and coaching. Now, opportunities, do they even have it? And sometimes it's not only, they really don't have the opportunity to do it, and so we need to figure out their schedule to fit it in, or they're missing. So they're failing to see the opportunities, and so they're missing them. And how do we develop strategies? We know they have the knowledge and skill sets and the efficacy, but now we got to create the opportunities. And then the last here is motivation. They don't believe in doing it, or they don't believe it will work. it. Relative to advantage to doing stuff, I'm going to just cruise with status quo because I don't think it's worth it for myself and the students. The outcomes that I would expect by doing it are low. It's called outcome expectancies. Do you even expect the outcomes to be able to be achieved as a result of doing that? Yeah, and stress, though, saps motivation. That's how stress works. How many of you, if you're like, we call it what, COVID fatigue now, it's just kind of the constancy of that. And now we're just kind of feeling less than our stellar version of ourselves consistently, and it saps motivation. Even things you like doing, when you're stressed, you feel less like doing those things. And so those things eat away at motivation. Decision fatigue too. Just many things. So I'm going to present a model. Now, this is called the HAPA model, the Health Action Process Approach. It's an evidence-based theoretical paradigm that's been used largely in health behavior change, getting people to consistently take their medicine or adhere to a nutrition or physical activity regimen. There's tons of research to support its use. And there's two phases to all behavior change. There's a motivational phase, but we know that people are motivated don't necessarily enact the things they're motivated to do. Many of you are motivated to volunteer, but you're not volunteering and spending your time in those ways because there's things that are getting in your way of enacting those things. Some of you are, but there's a lot of things that we're motivated to do that we're not doing. But we got to motivate people. And so this is how I like to break it down. Motivation means I need to do it. I have beliefs. These are all beliefs. I have beliefs I need to do it because I'm aware of the need and I recognize the problem that exists. And that this practice is a solution to that. I want to do it. I know that doing it will produce beneficial outcomes for the kids that I serve. I feel compelled to do it beliefs. People, when they're uncertain about making a change, we look to trusted, respected others. These are the social norms and expectations we can create around implementation. So I feel compelled by others to do it. Social pressure and expectations. I can do it beliefs is confidence or self-efficacy. And then I will do it is the highest level of beliefs that are supportive of whether someone will engage in a behavior. You ask them the behavior, you spell it out for them, and they tell you, I'm committed to doing it. That's the most proximal predictor of actual behavior change of a new behavior. But the issue is we have this motivation to action gap, the intention to behavior gap. Motivation alone is insufficient to promote behavior change. People get stuck with enacting new behaviors that they're motivated to exhibit. Think about anything in your life where you wanted to be more organized or cleanly or work out more or eat slightly better. Enacting that isn't simple. Enacting those changes isn't just you made your mind up and you started doing it. Many people start and stop. So we have this enactment phase. People need supports and processes to follow to enact the new behaviors. So we have to support people to be able to enact. Now, how do we support people to enact behaviors? You have a motivated workforce who want to do X practice. How do we support people to enact the behaviors? Plans are critical. It's called implementation planning. There's two parts, action planning and coping planning. Action planning is the detailing out how, when, what resources, and then coping planning is supporting people to identify the barriers that are going to make following through that behavior hard and developing if then or when then plans. If the barrier comes up, then this is how I'm going to overcome it. And it's been shown through research, if you engage people in really thoughtful implementation planning, they're significantly more likely to follow through and enact the behavior. And then you have consultation, back-ended consultation. This is front-ended consultation, supporting people through really high-quality implementation planning. And then back-end consultation is monitoring and providing feedback and collaboratively problem-solving what's got in the way. So enactment becomes pretty important. Here's an area of discrepancy in just broader kind of universal. What actually gets implemented? So we clip chart and we systematically demote kids from, you know, whatever color to red to hell and wherever we're taking kids. When they screw up, it's an anti-motivation system. That's what actually gets implemented in many classroom environments. What doesn't is the most widely researched universal prevention program ever, the Good Behavior Game, that's had over 20 randomized control trials, and over 90% of people in education have never even heard about it. What's the issue here? What explains why that phenomenon is? We're likely to see this ineffective thing more than the most effective thing. Marketing. Where do teachers go to for information? How many of you, they don't necessarily go to North Carolina, or they don't go to What Works Clearinghouse or the Evidence-Based Encyclopedia? Pinterest? Teachers pay teachers? Where are people going for their information? This is a prime example of losing the dissemination game. You all have to win at the dissemination game if you want to move the needle. That doesn't mean people are going to enact, but if you don't get win the dissemination game, people aren't going to be aware, knowledgeable, and motivated to want to make changes through the delivery of evidence-based practices for students with ASD. You got to win the dissemination game. And that means very thoughtfully crafted messages that are persuasive to help people become more aware and knowledgeable about that. Because if you don't win the dissemination game, that which gets disseminated and access is going to win out in classroom contexts. And that's ultimately what's going to win out and be received by kids. And many times, researchers are the worst at dissemination. What is our incentive structure? To publish in journals with impact factors, and then we bean count how many we got, and that's how we get promoted. They don't talk about how much real world change have you helped produce to make actual difference in the lives of people. We never get evaluated on that crud. That should be how we're evaluated. So we have no incentive to disseminate. So things get in journals, and it's dependent on people like you who actually take up the torch of effective dissemination and really help identify the people, the leaders who are in charge and creating the conditions for implementation to happen, and the people who ultimately are expected to implement to become aware, knowledgeable, and motivated. So I want to just put this in perspective. So we have implementation phases, okay? There's stages of the implementation process. And I like to just cut it down to 3. We have pre-implementation, and then people are going to be at different places at each of the stages. So where are people at in pre-implementation? There's 2 kind of types of people. There's intenders. Those are people who, once they learn about it, they intend to do it. And then you have pre-intenders. They learn about it and they do not intend to do it. Pre-intenders, if you move them to active implementation, they don't adopt doing it. And not only that, if you try to bug them to do it through coaching, they start getting annoyed by you. Because here you come, you're a stimulus for change, and they have no interest in changing. And you actually potentially harm relationships. So what this is helpful is to kind of do a diagnostic of where are the people we're working with at, and how do I adapt my behavior depending on where they're at. So if I know I'm working with a pre-intender, my goal isn't to help them plan how to do it. You're jumping the gun. Planning assumes a properly motivated person. Hey, you want to do some planning to do this thing that you don't want to do? They're like, oh my God. Ugh. They go home and tell their significant others, can you believe what I had to do today? I had to plan this stupid thing that someone's trying to get me to do. That's the type of conversation they have. Active implementation, once you start it and you've done the training, now people fall out in 3 groups. There's actors. Actors are people who are starting to do it. They're trying to change their behavior. Then you have intenders, people who, even though they got trained, they wanted to do it, but they haven't gotten around to doing it. And then you have these kind of chronic pre-intenders. Now at sustainment, we get even more. We get sustainers, we get desisters, people who are doing it, now they want to stop doing it. But the point here gets back to that idea of heterogeneity. And I don't want to make this seem too like technical, but this can be really helpful to try to diagnose who I'm working with, where are they at, and where am I at in the implementation process? Because I can be way more strategic if I start to factor these things in. And even if I don't get it perfect, being strategic on that level is better than not being strategic at all and just plugging away as if everybody's in the same spot and you're not attending to the specific stage of the implementation process. Because when it comes down to it, we have these groupings and that we're trying to establish their motivational state around doing or supporting the thing. Now, intenders are motivated to do the thing, and how do we actually provide the right strategy based on where they're at? Now, if they're pre-intenders, they're either ambivalent about doing something or they're opposed to doing it. And how do we actually use more motivational strategies to boost their commitment to want to implement? And we got to have, is it capabilities? Is it opportunities? Is it motivation? Now, once we started active implementation, we still need to tailor what we do. Just like we would with a kid, we got to tailor our supports. If it's actors, we need to celebrate them. We need to affirm them and validate the energy and effort. And we need to do that really well. Now, we don't need to say, we need them to look back at their plans and anticipate things that are going to make it hard to get to fidelity and really start to detail how to get to fidelity. So we revisit and repurpose the plans. And then it is monitoring and feedback because they're motivated. They look at the feedback as informative versus of annoying or evaluative. If we have intenders, this is where it's all barrier stuff. Something's getting in the way of the person following through with the thing they're motivated to do. So really a staple of strategies for intenders would be problem-solving barriers, identifying barriers that are getting in the way and problem-solving and creating plans on how to overcome those barriers. And then the pre-intenders is really getting diagnostically, what's the reason why they're not motivated to want to do this thing? What's at the kernel? Do they not believe it's effective? Do they ultimately just, they don't feel efficacious no matter what? They just don't feel like they could ever pull it off. And that's where we start to tailor our solution to the reason why they're not motivated. And so we have to start to understand why they're not motivated in order to be able to develop solutions. Diagnosing why, are they not aware of the need or recognize the problem that exists in the system? So we need to tell stories, use data to really elevate that there's a need and problem. Do we need to help them understand that doing it will have beneficial outcomes so they want to do it? Do we need to create social norms and influence through testimonials, site visitations, so they see that trusted, respected others like them who are effective in their role, that's what they're doing? Or do we need to actually boost their self-efficacy so they feel like they can do it, given everything else that's on their plate? So we start to understand. And what we're doing, just like in anything we know, when we do engage in an information gathering process and we're trying to be very intentional, we're trying to develop a hypothesis statement. We believe that this explains why we're seeing the current behavior. And we believe if we make these changes, we can start to move and change the person's behavior to be more supportive of the adoption and delivery of known effective things. And so whatever paradigm you're using in that step 2 of the problem solving process, why does the problem exist? We need to come up with a hypothesis statement that we think accurately conveys why we're seeing the current status quo behavior that's insufficiently meeting the needs of kids. And what are we going to need to take into account to move the people's behavior in a way that they start supporting the use of a known effective practice that kids need. And so when we do that hypothesis statement, we're going to then translate our strategies into an action plan. what strategies, who's going to do it, by when, how, what are some of the anticipated obstacles, us being able to, as systems change agents, putting that plan in place. Because as systems change agents, we need to know we can have an influence on leadership behavior. That could be the make or break regarding whether the expectations and the priorities are set and whether people ultimately perceive that the implementation work around an evidence-based practice is important. We can take that paradigm and apply it and come up with a plan. We can apply that at individual implementer levels as well. So some of the takeaways I want to leave you with. Students cannot benefit from practices they don't receive. Implementation boils down to adult behavior change. Behavior change is your bread and butter. You have the tools to influence behavior change among many. Apply a problem-solving process to adult behavior. Identify what the problem is in terms of the discrepancy between where their behavior needs to be and where it's currently at. We're trying to alleviate that discrepancy. Then we got to analyze why that exists. Analyzing why that exists gets us to more a precise place around a solution that we might be able to put in place to move behavior change. Use an evidence-based paradigm to explain why you're seeing, and that leads to effective solution. And then turn that hypothesis into a plan. In your plan, to enact the plan, you may need support from others. But we have kind of a process that we can apply to. You all have the basic building blocks of behavior change that you can leverage for systems change among the people who are there to lead and ultimately implement the thing, whatever the thing is. And if it's not you, then who is what I would just say. If it's not you all as a group who's really organizing and serving as a catalyst across the state that's trying to make an influence and make implementation happen for students with ASD, then who's it going to be? And so you all have that. And I just want to leave you with what I think is kind of a motivational little image, and I'll let kids hopefully jazz you up for the rest of the day, not me. Down there?
If you're tired of starting over, stop giving up.
Here's the deal. I can do anything, be anything, create anything, dream anything, become anything.
My dad always says, you are what you do, not what you say. Well, you grown-ups say you love us, but I challenge you, please, make your actions reflect your words.
If you believe in yourself, you will know how to ride a bike. If you don't, you just keep practicing. I like my pajamas. I like my stuff. I like my rooms. I like my whole house. My whole house is great. I can do anything good. Yeah. I can do anything. I just want everything to be good as possible. Nothing else.
You better not give up on us. No, you better not. Because, as you know, in some cases, you're all we've got.
And if I can be nice, I think all of us can be nice too. This is your turn. Now go out there and take it.
There you have it. You all can make such an amazing difference in the lives of kids. And we all recognize the importance that evidence-based practices play in making that difference. And it's through high quality implementation that we can actually achieve the types of outcomes we want for children and families. Thank you all.
Thank you so much, Dr. Cook. This was amazing. Everything I think we needed to hear right now, just in terms of thinking about implementation, especially in this this particular time period. So We thank you very much for that. And I'm sure you can see scrolling through the chat, all of the appreciation from our cadre as well. So Anne's going to go ahead and just review our next steps with us real quickly as we get ready to head into the break. If you guys have questions that that you didn't feel were answered, or I know some of you were asking for some of the COM-B information, we'll go ahead and try to get some follow-ups for you on that and maybe disseminate that through our listserv to those of you who are interested. But right now, what do we have going on, Anne?
Heather, our Spirit Committee Chair, and Jenica Lee, we have some prizes, you guys, because you know at Captain, we always have prizes. Heather, take it away.
Yeah, so even though we're not in person, we are still having spirit. So we have this Wheel of Fortune, Wheel O Captain. So can we make it spin? Ooh, our first winner is Robert Hefner. Congratulations, you get a $20 Amazon gift card. And one more time. Katrina Jones, you are also a winner. You guys will both get $20 Amazon gift cards in your emails today. Congratulations. Stay tuned for more spinning.
Yay. So let's take a look at the agenda. We're going to take a break from now until 10:20. So it'll be really quick, but that should be doable for all of you. And when you come back, we will go over hot topics and year in review. So enjoy your break.
All right, everyone. Hopefully you had a chance to run to the restroom, maybe grab another cup of coffee. We're going to go ahead and get started with the next topic on our agenda, which is our year in review and hot topics portion of the day. And just to remind everyone and to let everyone who might be a new cadre member know a little bit about this section, this is an opportunity for us to provide you with some information about what's been going on with our captain research, to give you back some of the information from our annual captain survey that you guys complete each year, and to provide you with some changes to policy, research, and practice that have come out since the last time we were able to convene. So it's a pretty fast-paced part of the day, and the intent is not for you to be trained on all of this information, but for us to provide you with awareness and some resources for you to follow up if you want to dig deeper into any of the policy or research that we're sharing with you today. All right, Anne, go ahead. So we're going to start with our captain year in review. Next slide. So as all of you, I'm sure, are very well aware, the numbers of individuals with autism and students with autism that we're serving continues to increase. This is our latest annual data indicating that currently students with autism make up a little over 16% of students with disabilities that we're serving through special education. Next slide.
Okay.
Do you want to exit and then?
Yeah,
Okay.
I got unmuted and then it had to mute me again. Talk amongst yourself, everyone.
So our current cadre numbers, we currently have 434 total cadre members that are representing the various agencies this year. 350 of you are from schools and SELPAs. 50 of you are from regional centers and 30 are from family support agencies. And we did an active effort to recruit additional family support agency cadre this year. And we almost doubled our numbers. So that's great news. Next slide. Just a reminder to everyone of Captain's vision and mission. We are a multi-agency network developed to support the understanding and use of evidence-based practices for individuals affected by autism across California. And we're multi-agency with representatives from the regional centers, the schools and SELPAs, and the state and federally funded family support agencies. Next slide. Our goals are really to do all of those things that Clay talked about in his keynote this morning, to increase knowledge about autism and evidence-based practices through systematic dissemination of information, raising people's awareness and understanding of what these EBPs are. And then number two, to increase implementation with fidelity, to help people use these practices the way they were intended so we can improve outcomes. And third, to increase interagency collaboration so that we can leverage our resources and really standardize things across our state. So we're sending consistent messaging and getting that information out in a way that can be used in our communities. Next slide. So how do we accomplish the goals of Captain? Well, we work with your agency leaders and with other professional groups to help them understand what Captain is, and to help them understand a bit more about implementation science principles. We then ask those agencies to recruit the best cadre from each of the stakeholder groups. And that's you guys. You guys are the boots on the ground, the ones who are really out there doing this work. We support the use of high quality training and coaching processes and facilitate regionalized and job-alike networked improvement teams, which are the regional teams that all of you are a part of. And one of the things that we've been really successful in doing lately is applying for and leveraging some additional grant funding and grant resources to further our work and help us to really improve the work that Captain's doing. Next slide. So how did we do on our Captain goals and requirements this last year? Well, I'm sure it's no surprise to anyone that due to the impacts of COVID-19 and the stay-at-home orders and the shift to distance supports that we all experienced, that we weren't able to accomplish a lot of our goals, and they did go down a little bit this year. However, I think we really should be very proud of the fact that our regional meeting participation increased pretty significantly. And I think that may be part and parcel to the crisis that we've been involved in. We've really relied on each other and supported one another in how to do this work as we've made this significant shift. Next slide. We asked you guys some specific COVID-19 impact questions in this year's annual survey, and these are some of the results. Many of you said that due to the crisis, it became impossible for you to continue doing information dissemination. However, about 60% said that you were able to continue to provide information dissemination using different methods than maybe you'd been using before, like distance technology, for example. In the area of coaching, about 40% of you said that coaching was impossible due to the impacts of COVID. And about 17% of you figured out ways of being able to do that, that coaching using distance technology. And we're going to talk a lot about that in our Schools Job Alike breakout and in some later portions of the program. Many of you said that you were able to make a shift from doing that more traditional coaching to doing more consultation and really supporting people in that way. And a lot of you said that you were able to continue to provide evidence-based practice workshops using distance technology like webinars. That was about 40% of you. Next slide. The need for awareness and understanding of evidence-based practice, almost 60% of you said that that need actually increased as a result of the crisis. And many of you, about 51%, or sorry, 42% said that you were able to bring groups of professionals together in professional learning communities to help support them using technology during the COVID-19 crisis. Next slide. So Captain responded and tried to pivot as quickly as we could. And with a lot of your help, we were able to pull together some resources and curated them on a Padlet. We had it available in both English and in Spanish. And that seemed to be a resource that was really helpful during this time. 60% of you indicated that you made use of that. It is still available and on the Captain website. And if you're not aware of the resources that are on there, we'd encourage you to go check those out and figure out ways of continuing to use those as we make this transition back to in-person supports. We also held a check and connect at the end of the year and a showcase where we shared with you lots of different resources that you guys had developed as well as those things that we had compiled. Many of you used that, as well as some of the webinars that we did during the spring and that are posted on the Captain website, such as the Autism Echo series, the Captain webinar with CCEE, and the Captain webinar we did with the Family Resource Center Network of California. We're glad that we were able to bring those to you, and please do, if you haven't looked at them recently or if you're not familiar with those resources, check them out, because we think they'll continue to be a valuable resource for you as you go forward. Next slide. So I want to give you an update now on one of our grants, the SELPA Content Lead Grant with Marin County SELPA. Next slide. So this grant was really intended to support the SELPAs in developing the capacity to support the districts in implementing evidence-based practices for individuals with autism. And this goes back to that formula that Clay said we should all have tattooed on our body somewhere. We have our what, our how, and our context that should all together equal better outcomes for students. This grant has really helped us to focus a lot more on the context in creating systems within the SELPAs and LEAs that can support the use of evidence-based practices. Next slide. And one of those really important system supports we found is to have a regional implementation lead identified and active within each of our 17 Captain regions. We started last year with 8 regional implementation leads and added 5 new implementation leads for this coming year. And we'll be recruiting for the additional regional implementation leads next year. And you see who those current 13 regional implementation leads are here on this slide. Next slide. Go ahead and click through these, Anne. The 13 regional implementation leads that are in place are all across the state. We tried to really select so that we would have coverage and be able to start working in various areas across the state. But we do still have 4 regions that will be adding to our pool next year. That's Captain Hook, that's the Stockton, Central Valley area, San Diego, Captain Los Angeles, and Captains of the New Wave. Next slide. So part of the role of these regional implementation leads is to help us help you to be able to do really high quality professional development and coaching. And the reason why we're really emphasizing and focusing on this is because we know that this yields the best outcomes and the best chance that we're going to get the implementers engaging in the implementer behaviors that we're trying to teach them. Next slide. So high quality training and coaching practices is really our emphasis and what our regional leads are supporting us with developing. And some of the new resources that we have that we're rolling out to you guys this year include some things like some pre-developed PowerPoints that have prompts for us to be able to embed things like practice opportunities, planning, and implementation planning activities during each of the trainings, pre and post knowledge assessments, opportunities for showing live or video demonstrations, all embedded within the PowerPoint presentations. And then of course, we've added some additional resources and supports for that high quality coaching and mentoring, and meeting with your agency leaders and your direct supervisors so that we can start to really educate everyone around the supports necessary for implementing evidence-based practices. Next slide. So how are we doing with the high quality training and coaching methods? This data represents 3 years of data that we've been collecting on how you guys are going about doing training and how you're going about doing coaching. The blue is the 2017-18 year, the orange is 18-19, and the gray is this past year based on the results that you just gave us ending last week. So you can see that as far as high quality training practices, we've got a lot of people doing discussion of facilitating discussion groups and planning for next steps during their trainings. A lower percentage testing for knowledge, and many of you who are providing opportunities for practice and demonstration of information and skills and training. Our goal is to really have all of these high quality training practices at the 80% or higher rate of occurring, because that's when we know we're going to get the biggest bang for our buck. So we have a little bit of work to do there, but lots of really good things going on out there in terms of training. When it comes to coaching, checking for fidelity of implementation, evaluating student data, and conducting direct observations are 3 of the core objectives that we have for high quality coaching. And you can see we have a little bit of room for growth there as well. Next slide. You guys are probably interested to see what each other is training on. So we've compiled here for you the top 10 most commonly trained evidence-based practices. Those are on the left-hand side. No surprise, kind of the big 3 are visual supports, reinforcement, and prompting, followed pretty closely by antecedent-based interventions. And then the top coached evidence-based practices follow suit, with the exception of a couple. We see that there's a lot of coaching going on PECS, but not a lot of training done on PECS and functional communication training. So a few differences there, but the top trained and coached evidence-based practices by you as the cadre. Next slide. We also asked you to identify which evidence-based practices you're most commonly recommending for the different areas of need that a lot of our students and individuals with autism have. So you can see we've broken it down by social, emotional, communication, behavior, mental health, and academic. And some common high flyers up there as well. You see visual supports, reinforcement, antecedent-based interventions mentioned across lots of different domains. Next slide. We also asked you, what are the evidence-based practices that you're most commonly recommending or training and coaching general education teachers on when you're supporting students who are included? And visual supports, reinforcement, and antecedent-based interventions were the top 3 in that area. Next slide. Barriers, a little bit of a shift in barriers that we saw this year. One that far exceeded the rest was teacher release time for training. What we do with this information, just so you know, is we'll report this information back to your leaders of your agencies and ask them, first of all, make them aware that these are some of the barriers that you're encountering, but also ask them what they might be able to do to support some changes in these areas. And we'd encourage you guys to do that as well. When you meet with your direct supervisors, when you meet with your agency leaders, which are both a requirement of Captain, we'd like for you to share this information with them and do some brainstorming around ways of being able to work around some of these barriers. Next slide. Organizational factors. This is a set of questions that we ask you every year to determine whether or not you feel that you have the authority and knowledge to be able to impact some systematic change or implementation in evidence-based practices. And you guys continue to really express that your knowledge is there and that the motivation within your organizations is there, and that there are a few areas like staff within the organization may not be motivated to share information, but the leadership is. So this is valuable information just in terms of thinking about where we need to sort of focus our interventions, and working with highly motivated leaders to increase the use of evidence-based practices is incredibly helpful. Next slide. This last year, we also asked you a series of questions about the implementation strategies that you find most helpful at the different phases of intervention. And many of you said that visiting other sites where implementation is being done and being done well was incredibly valuable and useful. So one of the things that we're going to begin working on as part of the SELPA Content Lead Grant with our regional implementation leads are to identify and really support and set up some demonstration sites, so that hopefully we'll have a place where you can go to be able to see evidence-based practices happening in a classroom, but also to learn about the systems that have been put in place to support the sustained use of those practices. Next slide. You also indicated that the use of prompts and reminders is an incredibly valuable implementation strategy when you're working with implementers to use a specific evidence-based practice. Using prompts and reminders for them is something that you guys all indicated was highly useful. So that's something that we're looking at and trying to figure out if there's a way that we can either through some kind of electronic means or through a system of prompts that we can develop for each of the evidence-based practice that we might be able to roll out to you guys to help support implementation. Next slide. Next slide. Okay, so responding to your cadre needs, one of the big reasons we have you complete this survey every year is to figure out what we can do then to better support you. So I mentioned earlier that in response to the amount of time that it takes you to prepare PowerPoints, we took those top 10 EBPs and developed PowerPoints for each of them, as well as pre and post knowledge assessments that can be administered for each of those trained evidence-based practices. And fidelity checklist that you see right here for you guys to use to ensure that you're hitting all of those high quality training and coaching practice marks. That's something that we've developed and it's available on the Captain website now. Next slide. This shows you those top 10 EBPs where you can find them on the Captain website and the various prompts that we've included to help you know when to do different types of high quality adult learning practices. Next slide. Meeting with direct supervisors. This is one of the requirements of Captain Cadre, and you can see that we've sustained pretty high rates of meeting with our direct supervisors. About 10% of people indicated that they're meeting with their direct supervisors less than one time per year to sort of review the Captain requirements and expectations. Part of us helping them know what behaviors are expected of them is having these meetings with them and reviewing the requirements of your participation in Captain, and perhaps reviewing some of those barriers so that they might be able to help you put in place some of the things to overcome those barriers. Next slide. Even fewer of you are meeting with your agency leader, but remember, it's that agency leader that actually nominated you. They're the ones who sent in your name and said, this is the person that we have identified that can fulfill all of these obligations and requirements to be a cadre member. So, you know, it's a really great opportunity to sort of think about that higher level leadership shift that may need to happen to get more support for evidence-based practice and more support for you as a cadre member to go ahead and plan those meetings. And we encourage you to do it within a couple of weeks of the summit so you can share back with them any resources that you're taking away from this event, as well as your regional implementation plans. Next slide. So in order to support you in meeting with your agency leaders, we actually developed a fillable PDF, and we have one that's available for meeting with the SELPA director, one for regional center directors, and one for family support agency directors. And this just provides you with prompts for what to talk about when you have those agency leader meetings. It reviews the requirements and details out the implementation plans that you and your leaders can establish for doing the training and the coaching and the information dissemination and all of the other components of your captain participation. Those are available on the website, and they are a fillable PDF. So with that, I am going to hand it over to Jessica Sir-Heinrich. She is the primary investigator and coordinator of our research team for Captain, and she's going to provide you with some incredibly exciting updates and discoveries that we've made through our Institutes for Educational Sciences grant. Jessica?
Hey, thank you. So some of you have seen this slide before. Many of you have participated in our research over the last few years, but I wanted to give an overview first. So we receive funding from the Institute of Educational Sciences, which is the research arm of the Federal Department of Education, to better understand how Captain is working and many of those contextual factors that play into how well we can impact our local community in terms of EBPs and some of the statewide factors that also may play a role. So this project had 3 phases. The initial phase was really using the data that comes from us as a cadre internally. So our annual survey data, and also some additional qualitative information from focus groups. So we wanted to better understand the experience of you as cadre members. The next step, or the next phase, was getting a broad statewide understanding of how implementation was happening. At this point, we were interested in both going higher and lower within our organizational structures. So having leaders respond, having direct service providers, teachers, paraprofessionals, and others within the service system provide information on their experience implementing or attempting to implement practices to support individuals with autism. And then the third piece has to do with a social network approach. So that's essentially asking, for you as a cadre member, what does your network look like? What contributing factors do you have to support the work that you're doing as part of Captain? And I'm happy to say that we have some results to share. So this is very exciting. In terms of the statewide survey, we had over 2,500 participants. So thank you to everyone who completed the survey, but also forwarded the survey on, left postcards when you visited classrooms, and in general promoted the completion of this work. So we had a great turnout in terms of response. About 1,500 of the survey completers were direct service providers, teachers, and others who work directly with students. Of those, 330 providers had received specific training and evidence-based practices from you, our Captain Cadre. In addition, of those 1,500 direct service provider completers, 253 completed additional surveys about their EBP knowledge, fidelity, and classroom quality. So this allowed us to compare those direct service providers who were trained by a Captain Cadre to those who were not. And here are some of our initial outcomes. Providers trained by Cadre reported significantly higher classroom quality overall, specific knowledge about evidence-based practices to support students with autism, and feelings of competence in implementing EBPs, competence in explaining their most used or their favorite EBPs, and openness to trying new EBPs. So we saw a significant difference in each of these areas when we compared those providers who were trained by Captain Cadre to those who were not. We were also interested in specific quality pieces. So providers trained by Cadre reported greater use of EBPs at high fidelity at an 80% or higher level, using all the components of their primary EBP to a greater extent instead of picking or choosing specific components, using their primary EBP with most or all of their students. So when we're thinking about that element of reach and how many students are benefiting, our direct service providers trained by Cadre were using these EBPs with more students. And then also, and critically, collecting fidelity of implementation data and student data to inform their practice. For those of you who are interested, here are also the statistics and the significant values. So here's another critical piece, which probably comes as no surprise to anyone. Leadership matters. So from the statewide survey, as I mentioned, we were gathering information from directors of agencies, SELPA directors, special education directors within school districts, principals, and others who were involved in the educational system. So what we have from our SELPA and LEA leaders is information about their own understanding of implementation and how that relates to Cadre performance. So Patty just talked about coaching outcomes, training outcomes, use of high quality practices. We quantify that across all Cadre to get an understanding of how well each and every one of you are doing and how well we as an organization are doing. So what we see is that Cadre whose leaders self-reported better EBP leadership attributes, so knowledge, support, and perseverance, those Cadre trained more providers, tested for content knowledge more often when they were actually training, and used videos or live demonstrations more often when they were training. So having a leader, having a LEA or a SELPA leader with EBP leadership qualities actually appears to be related to Cadre positive outcomes. Also, greater EBP recognition within the organization. So that is that positive reinforcement that's actually meaningful. It was associated with more frequent use of fidelity checklists when Cadre were coaching. Okay, and here is our glimpse of some of that network data. So just to orient you to what you're seeing here, we have an example of the network, the professional network of two specific case studies. A Cadre member who performed very highly in terms of the coaching expectations, the training expectations, and the quality elements that they were pulling in. Their network is on the top. So each of these dots is representing someone within their network, someone who they thought was integral and part of their professional work. When you see that network of the high performing Cadre, you see a lot of linkages. This means that not only were there many people in the network, but the people within the network are connected professionally. Another thing that you might notice is that there are more blue dots as compared to the bottom figure. The blue dots represent people that the Cadre member said has high EBP expertise. So a high performing Cadre member has more people within their professional network who are also knowledgeable about EBPs. When we compare to the lower performing Cadre member, what we see is more disconnected people. So there are fewer people within this person's professional network. They are not as connected, and also there are no blue dots, meaning there's no one that this Cadre member is professionally connected with that has high EBP expertise. Why is this important? It can really help us to better understand the possibility of adding additional supports. So if you are the low performing Cadre member, we want to better support you in enriching those professional networks, both locally and statewide, in order to enhance outcomes. Here are another few outcomes that are related to those networks. So greater number of coaches within your network was associated with higher performance scores. That means higher quality coaching, more training. A greater number of people with EBP expertise was also associated with these higher performance ratings. and increased captain cadre network size. So the general size of your network was related to higher performance. So basically having a larger professional network, having a network that includes people with high EBP expertise, and also other people who are providing coaching, those are all associated with successful captain cadre outcomes. And now I will hand it off to some other researchers on our team who are looking specifically at equity issues in terms of services within California.
Thank you, Jessica. You can kind of see now why I was so excited when I saw the data on the 95% of our cadre are participating in those quarterly network meetings, because that's a network of really well-trained people in your networks who have a lot of expertise in evidence-based practices. So good job, Captain, keep it up. One of the things that we've been increasingly growing aware of is the need to really understand equity issues around our work and around the services that we're providing for individuals with autism. And so we partnered with some of our partners within the statewide system of support and some of our captain partners earlier this year in September to bring to the state a webinar about building culturally responsive practices to increase access to evidence-based care for individuals with autism. And it was through that work that we really started to think about what a deeper dive in this area could look like. So we asked the California Department of Education to provide us some data, just looking at our autism numbers to see how the distribution was across different cultural and ethnic groups. Anne, if you could go to the next slide. So in pulling that data, we did make a little bit of a discovery, which if any of you guys know about, doing initial sort of broad sweeps of data, one finding creates 15 new questions, and that's exactly what happened here. We actually did see a pretty equitable distribution of autism services or autism diagnosis for special education across all of the different ethnic groups, with the exception of those who identified as Hispanic. We actually see that 55% of the population of California students is Hispanic, but only 46% of those identified with autism. And that does represent a significant discrepancy and under-identification. So that, of course, created lots of new questions that, that we're going to be looking into answering. Next slide. The other thing that came to our attention in last year's survey, we asked if you guys, how you guys were feeling as cadre members in terms of being able to reach individuals whose primary language is that other than English. And almost half of you, almost 44% of you said that this was an area that your organization was experiencing challenges in. So we really want to create an emphasis and a focus on this within our work. And we have a couple of our research team members who are taking this on and doing some work around equity and access for students with autism. Next slide. So the first project is being headed by Yui Youth. She's our new postdoctoral scholar at the Mind Institute working on Captain. And she's going to explain to you some of the work that she's going to be doing over this next year. And Melina Melgarejo, who's a research scientist at San Diego State University, who's been part of our research team for several years now, is also doing some work through San Diego State University and with her partnering Early Start Family Resource Center to be able to do some adapting of Captain resources. So Yui, do you want to tell us about the work that you're going to be doing over this next year?
Sure. In this project, we're looking at three questions. We have three aims specifically. We want to look at whether there is a true disparities in autism identification in special education in California across different racial and ethnic groups. We also want to look at disability identification in special ed by race and ethnicity over the past 10 years, look at the trend in disability identification. And the third question is whether there are discrepancies, inequities in service received for individuals with autism in special ed.
So we took our lead and are taking our cues a lot off of DDS and what DDS has done in their deep dive into the data, and are hoping that this will help us to see if there are any discrepancies and what we might be able to do about them as a network and as Captain to be able to support more equitable services. Melina?
Hi, everyone. So as Patty said, I'm going to share a little bit about this project that is funded through the DDS Disparities Funds program, and it focuses on the development of culturally and linguistically appropriate resources for families of individuals with autism. And the goal is to educate parents and stakeholders about evidence-based practices and autism, and also train providers in disseminating the resources. And so this project, as Patty mentioned, is a partnership between San Diego State, Captain, and the Exceptional Family Resource Center here in San Diego. And what we'll be doing for this grant is translating and adapting Captain resources for families who speak Spanish, Tagalog, Vietnamese, and Arabic. And we chose those 4 languages because they're the 4 primary languages besides English that are served by the San Diego Regional Center. And so here are our project aims. The first aim in our project is to identify needs. And so as Patty mentioned, we first did that by identifying needs of our cadre members. And the next step is to identify needs for families, as well as to gather their feedback on our resource adaptation. And so that is going to be done by conducting focus groups that represent each of the linguistic groups that we are targeting. And our second aim is to actually adapt the Captain resources or to develop new resources. And again, to educate families about EBPs and autism. And this adaptation of resources will be guided through an ecological validity framework that considers different dimensions of culture. And then our third aim is to disseminate the new resources through our partnerships with Captain and the Family Resource Centers across California. And so this will include developing a dissemination training protocol for our Family Resource Center cadre. And that will also include disseminating a survey to assess satisfaction with resources that will ultimately inform ongoing adaptation. And so right now we're working on this first aim, and we are still currently recruiting focus group participants for our Arabic, Vietnamese, and Tagalog focus groups. So if you know of family members or stakeholders who are interested in participating, please reach out to me. And then we are also still in need of facilitators for our Arabic and Vietnamese groups. So if any cadre are bilingual in one of those languages and would be willing to help facilitate, please reach out to me. We'll be providing the focus group guide, and we anticipate a time commitment of 2 hours, and we'll be providing a $50 incentive. So again, please reach out to me if you're interested. Again, we're really excited about this project, and we hope to expand on it to adapt resources in even more languages. And the next slide, Anne. So I'm going to pivot a little bit. We have another grant that was funded, and this project is called the Captain Adult Resources and Evaluation Project, or the CARE project for short. And this grant was funded through the Organization for Autism Research through an applied grant competition that's designed to address the growing need to support adults with autism and to improve outcomes in employment, living, and community participation. And so this grant is a partnership between Captain, San Diego State, and the Mind Institute. And what we'll be doing with this project is adapting EBP resources and the MPDC model to support the needs of adults with autism and the direct support professionals that work with them in community-based settings. Now, we did have a change in the service setting because of COVID-19. We were originally going to support training implementation within day programs, but again, because of the uncertainty with reopenings, we have pivoted and we'll be focusing on supporting within residential care settings. Next slide, Anne. And so the first aim, these are our project aims. And our first aim is to evaluate client, staff, and agency needs to inform our adaptation of the resources. And so we're currently working on that aim right now. We just recently disseminated an online needs survey to direct support professionals, administrators, and family members to inform, again, the adaptation of the resources. And we will also be conducting focus groups. So again, if you would be willing to disseminate the online needs survey, I can send the link out to everybody. And then eventually focus group recruitment will be happening as well. Our second aim is to adapt the resources and the NPDC model to support training implementation within the residential care settings. And again, this will be informed by the data that we collect through our needs survey and our focus groups. And then our third aim is to actually implement the resources and the model, again, within residential care facilities. We're starting with three facilities, and then we will evaluate client, staff, and agency outcomes. At the client level, we'll evaluate goal progress using goal attainment scaling. At the staff level, we'll evaluate fidelity of implementation, self-efficacy, and feasibility and fit of the resources. And then at the agency level, we'll also evaluate feasibility and fit, as well as some agency outcomes such as workers' comp claims. Again, we're really excited to continue these projects, and we hope to seek out more opportunities to support other settings and groups. Thank you.
Implementation awards. You all know about these. And by the way, there's 444 of you out there at our Captain's Summit this year. This is so important, and Clay talked about it a little bit earlier about how we create motivation and how we have tools that the research tells us really result in the sustainment of an evidence-based practice being used, the thing being used, and how that it can also be scaled up. And so these evidence-based implementation awards are really deeply rooted in research. So we know that for you to award this, you need to have done that great training. You're going to be using your great coaching skills. You're going to be using the implementation checklist. And you're going to make sure that the awardee demonstrates at least 80% fidelity with that evidence-based practice. And that needs to be over a period of at least 3 months. So that means not just during a single visit during the 3 months. And you all know that. The nomination process is really easy. The form is on the Captain website. It's PDF fillable. You fill it out, it's got directions to send it to me. And then what we do is we send out amazing award certificates. And what we want to do is everybody clap. Thank you, Jennifer Streeter in Captain 101 North. She has coached to fidelity. Casey O'Neill, Behavior Support Assistant for book 2 ABPs, Reinforcement and Visual Supports, and also Stephen Childs, who's at the Learning Center teacher. He got fidelity on the evidence-based practice for visual support. So congratulations. Even during COVID-19 and school closures, Jennifer Streeter and your team prevailed. We have a second set of nominations from Captain Bridges. Thank you, Lisa Field, for all your hard coaching efforts. Your awardees were Christina McKenzie and Mark Kodega, who are support staff at Mira Loma Elementary School, San Francisco Unified School District, and she worked on DTT with them. So congratulations. Like many of our things that happened this year because of school closures, we really want to honor these two, Captain Cadre, who prevailed and sent those in. So we really want all of you this year to figure out ways that you can continue to do your good training, to do your coaching, and do these implementation awards. Okay, we're on to hot topics. For those of you who are Captain Cadre from years gone by and continue to be, this is a very familiar moment for you. These are hot topics. They go really, really fast. They are meant to give you a sense of awareness about, oh, I got to learn more about that. But it goes really, really fast. So new Captain Cadre, hang on to your seats. This is your first hot topics. And really, we do go through these with the speed of lightning, but you have the PowerPoint. There's also, just so you're aware, some hidden slides that we won't go over today, but they're embedded in your participant folder PDF of this PowerPoint presentation. That's a deeper dive into some of the things. So hang on, here we go. You're gonna wake up. We wanna welcome our new captain leaders, Regina Reed from Ventura County SELPA, Robert Rochin, who's the director of the Early Start Project, and Robin Ryan, who's a coordinator of the Seeds of Partnership. We're thrilled to have you join us. And we also want to welcome Monica Pekarovich, who is a CDE liaison. So she keeps us informed on everything that's going up in the department, and we tell her everything that we're doing and all of your good efforts so that she spreads the word. So here we go with the school's hot topics. This is very, very new. We have made a change to the captain regions, which I think, Patty, we've only done one time before in our 8 years. We have moved Compton to Captains of the New Wave, yay. Tri-City has also gone to Captains of the New Wave. Pasadena, Foothill, and West San Gabriel, those cadre are now going to be part of CLIC. They've already been warmly welcomed and I think given opportunities to get their t-shirts and their hats and all of their particular captain region gear. We do this sometimes when we want to really make sure that our captain regions are as effective as they can possibly be. And so the research, as you heard earlier, when Patty and the research team talked about these network improvement communities, it's really important that everyone is participating in a way that they can be the best captain cadre. At this time, the regional centers will stay the same and the family support agencies will stay the same. So here we go. U.S. Department of Ed. There's a guidance document that's in your Summit Materials folder. There's the link. The bottom line, what this slide means is the feds have told us, regardless of the pandemic, it's business as usual for special education, and that we are to continue to provide FAPE, a free appropriate public education. That means we still have to do child find, we have to do eligibility assessments, and then if they qualify, to provide IEPs with all the supports and services. And so this is just to remind everyone, in case they hadn't heard, prevail. Now, here's just a little bit on ASD assessments during school closures. We think that CASP has done a really fabulous job with their guidance paper. This is the 4th one that they've put out, and it includes practice on assessments and guidance for 4 specific eligibility areas. So they've included SLD, OHI, ED, and then autism. So that again is in your folder, for the participants folder. We just downloaded it and put the whole thing in there. When you look at ASD assessments, these are 3 video presentation talks that Catherine Lord, who, as you all know, is the author of the ADOS. And so we've given you the links to these YouTube. She's out of UCLA, and she is the author of ADOS. And you can look at these videos. One is about autism assessments in the time of social distancing, and she gives her opinion about what that might look like. And then there's a follow-up Q&A with Catherine Lord, like, well, what did you mean by this? And then there's another final one, brief observation of symptoms of autism, the BOSA. It's a training by Dr. Lord's lab. her team there from UCLA. And so we think those are 3 really good videos that you can learn more about how you're going to do this. Now, having gone and talked to some legal counsel here, there, and everywhere, what we want to report to you is about your assessment reports for autism. And this holds true actually for all your other assessments, but especially autism. Number 1, make sure you have a multidisciplinary team. More is better now, especially as you move forward and in these unusual times and how you're doing it. So the more of you on the team to give more input, the better it's going to be. Collect and include lots of information from a variety of sources and contexts over a period of time. And then this second bullet is really super important. Make sure to describe the assessment parameters and alternative conditions that may or may not have affected your validity. Writing more descriptive information will be in your favor later on, should your reports and determination of eligibility or how maybe on your tries, how things are going. So make sure you describe thoroughly everything that was going on and how it may or may not have affected validity. And then, as you know, Captain, our saying, data is delicious. So data is good, and the more is better than less. Okay, Senate Bill 98. This is the one about distance learning. And basically it says, school districts have to offer in-person instruction. However, it does allow LEAs to offer distance learning. As you know, that's a new thing. And it defines what in-person instruction is and distance learning. And it outlines the circumstances when distance learning may be offered. And you guys are all experiencing this right now when they're giving, what tier in California you're in and how public health, that determines where instruction will occur. And so this particular law just continues to describe that in depth. And then the final bullet here, it really talks about how the needs of all the students and the staff and whatever infrastructure was going on was taken into account in making the decision about distance learning. There's some hidden slides on this to give you more information, and those are in your handout. So Assembly Bill 2657, you may remember, some of you who are not a brand new Captain Cadre, that we talked about this at the summit last year. It went into effect January 1st, 2019. So why are we talking about it today? Well, because it's important to know that it's starting to be at the point where we're going to be enacting it. So first of all, just for you to know, the restraint and seclusion added sections to the California Ed Code on the use of behavioral restraint and seclusion. Now remember, there already was one before for special ed. This one applies to all students who receive both general education and special education. That's a big, big difference. It's for all students and how restraint and seclusion applies to them. It also describes in depth and the types of restraints. So behavioral restraint, physical restraint, mechanical restraint, and the different types of seclusion, when to use and when not to use, and what's prohibited and what's not prohibited. And important in this law was that there needs to be public reporting. It's mandatory. The public needs to know what's happening out there in regard to restraint and seclusion. And that will be reported eventually using CalPADS. There's a guidance document coming out soon that will be posted on the CDE website that will really talk about frequently asked questions. So it's a little more digestible. So what do you do then? What do you do there? And questions and answers. So we'll let you know, as we always do on Instagram, Facebook, and a direct email when that gets published. So now this Assembly Bill 1172, there's new requirements for MPSs and MPAs. So this one actually was signed into law in October 2019, a year ago, but now it's effective January 1st, 2020. And what this means is that the MPS must have an individual on site who is qualified and responsible for the design, planning, and implementation of behavioral interventions. commencing in the 2021 school year, this year, the staff have to be trained in the use of evidence-based practices. And then this says specific to the unique behavioral needs of the MPS and MPA. So if there's an MPA or an MPS out there, and they say they are focused on specialists for students with autism spectrum disorder, they need to know about our 28 evidence-based practices. And the staff must be trained in positive behavior interventions and supports. Commencing this year as well, they have to collect data, they have to do analysis, and they use data to inform their planning and the implementation of their behavioral supports. And the LEAs have to do on-site monitoring visits and annually verify that there were those training requirements that took place. And we always say, who best to provide trainings about evidence-based practices in autism, but our captain cadre. And then commencing again this year, the administrator of the MPS and MPA must hold appropriate license or a credential from an accredited institution to really have an MPS or an MPA. So you can see the standards have increased and the accountability as well with this. So this is one, I call it this and that. So accountability. You all know that there was no testing for the 2019-2020 school year because the California Department of Ed asked the feds and said, hey, we need a waiver. You know, there's a world pandemic and how are we supposed to do this testing? Well, those days are gone. So council has told us that most likely, probably, absolutely, there will be testing in 2021 because the feds have said, we're not going to approve any waivers. So don't go thinking that you're not going to do testing again. When we look at coaching, we received a lot of information from some of you who are doing coaching for your students with autism and saying that you've been told, well, you can't jump in on this Zoom session because you aren't, you know, authorized to be there. And there's some privacy and confidentiality issues for you being here when you, maybe you're a self-employee and you're going to work with a teacher in an LEA. So we did ask council and they just kind of looked at us and said, you know, we don't think that coaching violates FERPA, which is the Family Educational Rights and Privacy Act. And that, of course, you're going to follow your appropriate local notifications and your protocols and make sure everybody knows, just like we have on our coaching checklist that Patty talked about earlier, the coaching fidelity checklist, which talks about, you know, making an appointment, making sure everybody knows, et cetera, et cetera. We've also been asked, you know, well, can we record the coaching session? Like I can't be on every Zoom call of everybody I'm coaching and many happen at the same time. And again, our legal counsel told us that it's probably okay to record that coaching session. But here's what's important. Make sure everybody knows that you're going to record it and that who can access that recording. And that, of course, it's going to be protected with the same confidentiality of pupil records and reports. And again, always check with your local administrator and your counsel. One of the suggestions the attorney said is like, you know, if there's other students and you're looking right at your student and your educator or whoever you're coaching, is maybe say, can all the other kids just have their first name on their screen, so that we're being careful with privacy issues and confidentiality issues. But if you treat it with the same regard that you do with everything that you keep on a need to know basis and who has access to that, it should be okay. Okay, we went over these with you at the Check and Connect in April. Actually, our Check and Connect, I believe, was April 29th, and these were released in April 27th. And so this is our brand new 2020 NCAPE Evidence-Based Practices Report. As you guys know, there's 5 new ones. So how are we going to learn about these new ones? Because we don't have AFFIRM modules necessarily for all 5 of those, right? So one of our recommendations is to read the NCAPE report. So if you look on page 28 and 29 on table 3.1, you're going to see that those 28 EBPs, their abbreviated definitions and the number of articles from each review period is right there. And then on page 63 begins the fact sheets. You know, These are the fact sheets. It has the name of the EBP, information about the participant and the ages and the positive outcomes if you use this one and select it. And then it has the full reference list. Well, what are we going to do about the 5 new ones that maybe we've done all the reading, but here's some other suggestions that we have. So for AAC, just remember that PECS moved into that evidence-based practice, and your SLPs can support AAC. They are capable, if they've had training in AAC, to be of support to your team in the meanwhile. And I think we pretty much know what that's going to look like in that Affirm module. Behavioral momentum. So for those of you with a BCBA, and I think there's a lot of you on Captain Cadre that are, you should know this one. This is, you know, what you do. And so you should be okay without the Affirm module for a couple of years or a year or however long it's going to take them. When we look at the 3rd new EBP, sensory integration, that one's pretty clear. On page 41, and I'm going to read it, it is important to note that sensory integration refers explicitly to the model developed by Jean Ayres, and not to a variety of unsupported interventions that address sensory issues. So if you read further in that, what it means is the person who's trained has a certificate, an official certificate in the Jean Ayres method, is going to be delivering the sensory integration in more of a, and I think in the report it talks about in a medical model setting. So we probably won't be seeing this happening in the schools because on how it's to be implemented is, you know, kind of more of a medical model based. When we look at the fourth new evidence-based practice on direct instruction, some of us were also scratching our heads. So we have asked the authors of the NCAPE for some more information. One of the questions was, well, what's the difference between DTT and direct instruction? So we're going to keep you posted and we're going to get some answers. And the 3 authors of the NCAPE report are going to be working with us to help us make do until those Affirm modules are developed. And then the 5th one, music mediated intervention. We again asked the authors because we said, what is that? So if you look in the report, it does say this includes music therapy, which occurs in a therapeutic relationship with a trained music therapist. And we go, okay, we got that. That's very clear. But then it says, in addition to the planned use of songs, melodic intonation, or rhythm to support the learning or performance. So we're like going, well, what's that? Like, how is that implemented with Fidelity? What might that look like? So stay out there and we'll get back to you on that. Some of you wondered where your favorite EBPs went from the 2014 list. So you'll see that PECS moved over to AAC and PRT moved to naturalistic intervention, scripting moved to visual supports, and structured play groups moved to peer-based instruction and intervention. So that's where you'll find those. And yes, I know this is foggy or blurry, but that's directly from their report. But we do have this new EBP matrix on the Captain website in our resources. And then we have our own EBP matrix that has all the abbreviations, the actual name, and then also the definition. And we have that in English and Spanish, thanks to our amazing Captain Cadre, who are bilingual. Now, this is brand new out of this report, and it's called Manualized Interventions Meeting Criteria for EBPs. And basically, they're interventions that really fit the evidence-based practice categorical definitions, but they have enough evidence to be classified as an evidence-based practice. And so they're manualized, meaning the manual basically is your implementation checklist. So we can see that on the left, there's a list of those that got special credit for being a MIMSI. And some of your favorites, the social stories and peers, actually are manualized. And some of you, 83 of you, are now certified trainers in peers because you came to our training. And don't forget to come in February because Carol Gray is going to provide a certification training in social stories 10.2. when we look at the focused interventions where they got recategorized. And so we just wanted to show you that these focused interventions, where you can go find them now in the evidence-based practice. But we thought it was interesting that handwriting without tears and touch point instruction or touch math, we've all kind of known that that works for many, many students with autism. And now we have research to support it. So good things comes to she who waits. Do not have sufficient evidence. So this is important. It's on page 31. And this is the list of those practices that do not have criteria to be an evidence-based practice. And so we see animal-assisted intervention, auditory integration training, massage touch therapy. We see sensory diet. We see all of those on there, and they continue to not have sufficient evidence to meet criteria for an evidence-based practice. So as we all say, children and families can't benefit from evidence-based practices that they do not experience. So go out there and implement those evidence-based practices. So I'd like to introduce now Dr. Laura Hall, who is the professor and chair of special education at San Diego State University. And she is on our executive leadership team for the SELPA Content Lead. And we are thrilled that she is part of our work, and she has some information to share with you.
Thank you, Anne. I'm happy to be here. I wanted to share what's happening with the education specialist preparation programs. As you may be aware, the Commission on Teacher Credentialing reviews and renews their standards and requirements for programs that prepare teachers. That would be for general ed environments, multiple subjects and single subjects, and education specialists that prepare in special education. So in 2016, they adopted new standards and teaching performance expectations for the multiple subjects and single subject credentials, or for general educators. And in these new requirements, there is an additional focus on multi-tiered systems of support and universal design for learning. And these credentials are now in place and well underway. In addition, as of 2018, the Commission adopted that they were going to go forward with 5 special education credentials, or education special ed credentials, in the 5 areas listed on this slide. So they will be mild to moderate support needs, extensive support needs, early childhood special education that is likely to be birth through kindergarten, deaf and hard of hearing, and visual impairments. So those will be the 5 new credentials. There are also teaching performance expectations, or elements of competence that the programs are writing their coursework to address. And these are specific to these credential areas, as well as cover what they're calling universal teaching performance expectations from general ed and special ed. So education specialists will have a solid foundation, ideally, in instruction and preparing all children, as well as the needed specialist areas listed above. And these new credentials, we're all right now in a transition period, and they will go into effect, the programs will go into effect starting fall or September 2022. In addition, a new aspect to this work is that the Commission is preparing a teacher performance assessment for education specialists. And up until now, we have not had a teaching performance expectation assessment. General ed, multiple subjects and single subject have, and by the bilingual authorization also have had a similar assessment. So this is likely to be a video-based performance assessment that is scored and rated by local experts in the different areas. And this is under development. And the plan is to roll the teaching performance expectation out to begin the year after the new credential. So in 2023, we to have the new performance assessment available for universities or programs that prepare education specialists. Thank you. And the next slide. We also wanted to share from the higher ed work group that we've been working on developing webinars that can support folks working in higher ed, but also preparation of personnel using evidence-based practices. And one of these webinars that have been that we've been working on and that was piloted by Michelle Dean, thank you, Michelle, at Channel Islands, is one that's focused on preparing mentor teachers. So mentor teachers are defined as those that are working with student teachers, or during the preliminary program, or mentor teachers that are working with candidates during induction. In California, teachers in all credential areas must work for 2 years with an individual mentor in order to complete their credential requirements. So if mentor teachers are providing coaching to teachers that are working with individuals with autism spectrum disorder, we wanted them to know about CAPTAIN, want them to know about the evidence-based practices and how they could use the resources from CAPTAIN in their work. So we have piloted this at Channel Islands, and you see some and got representative responses that that the mentors felt that it helped them, that the webinar helped them to develop consistent strategies based on evidence-based practices, help them to individualize supports for students with autism spectrum disorders. And they also found that it was supportive in that it emphasized research and evidence-based practices for their work. And we're going to have a package available for your use on the CAPTAIN website in the near future. The higher ed work group will be developing a series of these, we're sort of saying grab and go webinars that you can use or share with your colleagues, and we'll let you know as they become available. Thank you.
Now I'd like to introduce Dr. Yvette Baptiste. She is on our executive leadership team for the SELPA Content Lead. She is the chair of the Family Resource Centers Network of California and also the executive director of the Eastern Los Angeles Family Resource Center. Take it away, Yvette.
All right. Hey, everybody. I just want to say that this summit is so chock full of information, but what I'm taking away really is Dr. Cook's formula for success, right? Effective things times effective implementation times healthy context and preconditions. And one of the preconditions is parent and caregiver involvement, right? Unless you have that, you've got a big zero, right? So let me show you what we've been doing to help with that in our cadre around dissemination, implementation, and collaboration this year. So first, we've got these infographics, and I think they've been around for a while now. They're on the website. They are for families that you can share in English and Spanish. And we're going to be working on getting those in other languages. I think that's part of the project that's going on right now in San Diego. And then the next slide shows you the infographics that are for family support personnel. And really, it's something that can be shared, I think, also with school personnel, right? Your paras and other folks that are really supporting children and families, kind of like what it looks like on a Tuesday, somebody I know likes to say, so that they can kind of understand, you know, what is being done and why it's being done in the implementation. So we also, the next slide, and all of that is on the CAPTAIN website. So the next slide is what we have for you is really exciting. We have 2 videos that we've developed based on those 2 infographics. The first, I think the one you're going to see now is the one for families. And we really encourage you to, particularly in this time when families are connecting electronically with many of you, you can share this with them to kind of set the table in your discussion about EBPs. So let's show everybody.
All parents want their children to reach their maximum potential. Children with autism account for 16% of the students with disabilities in the state of California. One way to help all children with disabilities succeed is to ensure that the interventions and services they receive have evidence proving their effectiveness. This video is an introduction to information and resources that will increase your ability to help families to recognize and advocate for the use of evidence-based practices, or EBPs, with their child. The California Autism Professional Training and Information Network, CAPTAIN, is a network of community, state, and federal agencies developed to support the understanding and use of evidence-based practices, or EBPs, for individuals affected by autism spectrum disorder and other developmental disabilities. CAPTAIN's website is an electronic resource for parents to access information on a wealth of topics, including interventions and supports, research, online training, fact sheets, infographics, and news about upcoming local events, and much more. Why is family participation important? Parent participation is enshrined in the Individual with Disabilities Education Act, IDEA. This is because research shows good student outcomes are linked with active involvement of parents and/or caregivers. This way of working together acknowledges that interventions and supports for children with disabilities are most successful when the family's concerns, priorities, cultures, and beliefs are considered. Barriers to family participation, such as time, money, emotional stressors, lack of information, and confidence, are frequently systemic and have significant consequences. How does understanding evidence-based practices benefit children and families? Families are the experts on their own children, and their participation in intervention planning is crucial. Knowledge is power, and informed parents are in the best position to advocate for the most effective treatment and supports for their child. However, identifying effective interventions can be challenging. Interventions may be recommended when there is no scientifically sound research that supports their use. Being a trusted resource for information is the goal of CAPTAIN. Family support professionals can help families by conducting informational sessions to encourage use of the CAPTAIN website, conducting trainings on EBPs to increase parent knowledge of specific interventions, and encouraging families to identify and share their preferences and values in the decision-making process. Visit the CAPTAIN website to access information about interventions, treatments, or other services for which there is scientifically based research that demonstrates effectiveness. Find out which practices rely on rigorous, systematic, and objective procedures which deliver reliable intervention and activities. Some materials are available in additional languages.
So I know Anne and Patty really like these. They are really helpful. The one that you just saw actually is the one for family support professionals. So we're hoping that you, the FRCs, everyone who connects with those whose job it is to support families, view the video, or you show them the video so that they can know a little bit about CAPTAIN and be able to provide information. It's really about that dissemination of the possibility of implementation and practice down the line, so that we can get the word out that they're available to families, right? Families, Anne said it best. They don't know about practices that they haven't heard about, right? So the next thing I wanted to share, that's kind of what we're doing on dissemination, and we're also doing things like promoting on social media. But at East LA, we started a behavioral support group kind of before the pandemic hit. And we wanted to help families to really know about the practice of implementing evidence-based practices in schools, and to really understand what that means, and help with possibly implementation in the home, so that when the child is not at school, those evidence-based practices are being followed through in the home environment. So next slide. We kicked it off with a presentation by Jennifer Fisher, who's one of the co-leads of our Captain of the New Wave. And she shared some of the initial work that had been done in Los Angeles with students at the Southwest SELPA. And the parents were super excited about it. Our regionals, and we kept, then the pandemic hit. That was in-person presentation, then the pandemic hit, and we pivoted to providing it, the support over Zoom. And our regional center team, Liz Rogers and Emily Ramirez, they also joined with us on those Zoom calls to provide kind of technical assistance and coaching and support around any service needs, regional center service needs that emerged. And what we did is we went through and we reviewed the matrix of EBPs and the definitions documents. And we asked the parents to think about what might be most helpful to them at home. And I think the three common choices also are kind of some of the high flyers on our 10 list from the survey. And we actually landed on prompting. And so we started using all of our Captain resources to develop a PowerPoint that was more family friendly, more plain language. Next slide. And we started having our calls. Dulce Flores and Liz and Emily and I gave a presentation to the families that you see there on our little screenshot. And this was based on the Affirm modules, of course, and the additional resources that are there. And so the families have been doing a lot of learning, and our next steps is really to solidify some of their individualized goals and developing a plan and understanding data collection. And we're just going slow. So more to come. We're hoping to utilize some of the resources that that Captain has available, definitely for coaching for our team, to make this maybe a practice that other family support organizations can do in terms of parent implemented interventions. I think that's
very much. Now I'd like to introduce Dr. Carrie Yardley, who is on our executive leadership team for the SELPA Content Lead. She's also a clinical supervisor at the Regional Center of the East Bay.
Hi, Ann, thank you. So I think the theme in terms of our regional center hot topics is adaptability. We had to figure out how to adapt. So the first thing I want to talk about just briefly is our intake and assessment process. Next slide, Ann. We were given DDS directives in regional center, some guidance on what we were supposed to do in response to shelter in place. And basically the guidance was you have to keep doing intake and eligibility. And in order to do that, you have to figure out if these people who are coming to you have an eligible condition. So in doing that, we had to adapt our intake and eligibility process, which has relied very, very heavily on in-person assessments. Next slide, Ann. Thank you. So what we've done is we have moved into 3 different types of formats, depending on where you are across the state or which regional center you're in. So one of those formats is a fully remote assessment where we do our interviews, observations, and whatever elements of testing we can get through a HIPAA compliant telehealth format. Another one is a hybrid model where we do most of the things online, and then we figure out some sort of way to do a behavioral observation. And then the last model is an in-person model, which is a fairly traditional model of doing an evaluation to determine a diagnostic eligibility criteria. Next slide, please, Anne. So in terms of remote assessments, this has been the biggest challenge, I think, for our psychologists and probably for many of school district individuals who are testing as well. Figuring out how to do a remote assessment for it to be as reliable and as valid as possible. So we have relied heavily on clinical interviews. We've also relied very heavily on record review. So those two things combined. And then we try to include a cognitive measure. And so that might be an online cognitive measure, such as the WISC or the WACE through Q Global or Pearson. We try to do developmental testing when the child is young, and that might be help with parental help administering that test. And then people might adapt any part of a traditional IQ test that could be done remotely. And then there is also the adaptive measures such as the Vineland or the ABAS that is usually done through a parent interview online, and then ASD specific measures. So Anne mentioned the BOSA, which was developed by Dr. Catherine Lord's lab. The Tele-ASD PEDS, the Social Communication Questionnaire, or the ADIR are all examples of that. Next slide, Anne. So some challenges we've had with these remote assessments is that most of these tests were not designed or validated to be used remotely. Not all psychologists have been trained in providing remote cognitive assessments, which can be a challenge. Many assessment recipients are not comfortable or may not have the technology. And one of the biggest areas of concern, I think, for psychologists at my regional center is that there's not any interactive cognitive measures for ID testing for individuals who are under the age of 6. And when you're working with a young child anyway, they often struggle with remote assessments. So that is how we have adapted, and it's all still in progress. But in terms of, go ahead, next slide, Anne. In terms of adult services. So let's talk about that. We have developed alternative services for non-residential providers. So for adults who might typically, for example, receive services in a day program setting. Go ahead, next slide, Anne. So March 4th, 2020, shelter-in-place orders were initiated. With that, individuals had to stop attending day programs or supported work environments, and which meant that all of those providers, because funding for any of those places is tied to a person's physical attendance in that place. So it meant that all of those providers were at risk of not receiving any funding. And already they are so underfunded. So to not have any funding would mean that doors would shut. So DDS authorized absence payments. And these absence payments were meant to keep the doors open so that these programs didn't close down. But in that, there was suddenly a lot of flexibility that we didn't expect to have. It was traditional service delivery, or it was self-determination, but there was not really a third way. And what happened with COVID-19 and shelter in place is these non-residential service providers had to figure out how to provide a different type of service while keeping everyone safe from the spread of COVID. And so there was this new focus on flexibility, and these non-residential service providers really gained experience in how to provide an alternative community response. Well, around this same time, the Centers for Medicaid and Medicare Services said, no, we're not going to keep allowing you to have absence payments. So that's not going to work for us anymore. So DDS had to figure out a way to really institutionalize alternative service delivery. And they had to create rules and regulations around that. And so they proposed those rules and regulations in September. And then through stakeholder engagement, we're currently in the process of refining that. But really what this means, and it's really exciting actually, because it's this third way. So what this means is that federal funding and state funding is still happening for these day programs, but we're figuring out a new way to provide these services that really meets the needs of the consumer where the consumer is at, rather than making the consumer fit into a predefined model of care. So this is exciting. Anyway, all right, next slide. All right, I'm going to be presenting this information on behalf of Dr. Libero, and we will go to the next slide. This is the DDS updates. So we have two new big programs in the state of California, and one is the California START services. So START stands for Systemic Therapeutic Assessment, Resources, and Treatment. It is a very exciting program. It's an evidence-informed model of services and supports for people who have co-occurring IDD and mental health needs. The goal of the model is to reduce the emergency room and inpatient psychiatric visits, and then improve access to services across the system and improve caregiver well-being for people who are providing these types of services. So they do this through a cross-systems approach, and then they link people with the appropriate services that already exist in the community. When the community doesn't know how to meet the needs of our specialty population, they provide that training to raise up the community providers to have the ability to serve our clients who have this specialty need. And then they also provide individualized therapeutic supports and interventions to the person who is in that state of crisis. So next slide, please, Ian. So in terms of referrals, they work with anyone who is over the age of 6. I believe their program design says 6 to 106. And anyone who is at risk of currently experiencing a crisis. So we have 6 programs that are already happening or that are in development right now. And they are being served by San Andreas Regional Center, San Diego Regional Center. So those are the 2 that are already well established. They've been going for over a year. And then we have the 4 new programs at Regional Center of the East Bay, Alta California Regional Center, Westside Regional Center, and South Central. So that is the California START program. Next slide, please, Ann. And then there are also some new developments in terms of our residential care facilities. So we are developing, or DDS has developed a new model for specialized homes for children with complex needs. And there are 2 different models. These are 4-bed homes, and they have both of these types of homes have enhanced staffing, individualized behavior and emergency intervention plans, and then they have increased oversight by DDS and the regional centers. So the EBSH homes, the enhanced behavior support homes, these are long-term residential homes for individuals who have really complex behavioral needs. Right now, there are 7 homes that have been completed, and there are 10 more in development. And then in terms of our community crisis homes, these are short-term, up to 18 months, homes for, the goal of these homes is to stabilize an individual and to allow them to step down to a less restrictive level of care or back into their family homes. So right now we have 7 of those in development. And then for children who are dual agency involvement, that means that they're a regional center client and they're somehow connected to the foster care system. We also have 2 of the homes in each of those types of residential facilities are targeting that specific population, which is very exciting news as well. And that is all I have to report. Thank you for the time.
Thank you, Captain Leadership Team, for all your amazing presentations. For those of you who felt like it was fast, remember, this is being recorded and the entire PowerPoint, including some hidden slides on some of the more complicated topics, is in your participant folder. And as soon as we're finished today, we'll upload that recording as well. We want to encourage you to go to the Captain website. A whole lot has been added just in the last week. As Patty said, we have these 10 new evidence-based practice trainings right there. We have a new little click on the right under quick links called New Informational PowerPoint Presentations. And those are all those recorded webinars and PowerPoints in those family support videos. Thank you, Yvette. Those are amazing that you and your team created. We put one of them on the front of the Captain website, and then we put both of them here in the informational, all ready for all of you to use and implement. Check out all of these new resources in the resource list. So that's where you're going to find all the matrix and the family support regional center and the SELPA director, those guidelines on how to have those meetings. We have the activity matrix that's now in Spanish. We have lots of infographics. We collaborated with the English learner SELPA content lead, and we have an infographic on your favorite topic now, implementation and improvement science. So check out all of the changes. We have a lot planned for you coming up. Don't miss these professional development events. So on December 9th from 2 to 4, we have e-coaching training. These are only for Captain Cadre, and they are at no charge, and it will be, you know, registration again, and we'll be getting that out next. Social stories, don't miss that. It's 2 days, February 11 and 25 half days, where you can get certification in social stories 10.2. It's the newest, latest, greatest research-based way to write evidence-based practice social stories. And then on March 10th, we have Dr. Hall and her colleague who are presenting about secondary students, the Center on Secondary Education for Students with ASD. So everything you want to know about older individuals with autism. And you guys, there's 444 of you out there now. We're all going to be in Riverside next year. It's paid for because they let us move the contract over. And if you can see the place with the little twinkle lights, we're going to have a big party, and there's going to be cornhole and badminton and an open bar. We can only give you two non-alcoholic drink tickets, but there'll be an open bar there for you to purchase your own. And there's going to be dancing and music, and so get excited. This is amazing that we're doing it this way anyway this year, but we're so excited. This is a done deal. It's all paid for. When you guys have your regional planning meetings and your job alike breakout groups, that place is so huge that you're all going to get your own rooms. And that's always been something that's come up, is like, well, we have 3 other groups in here. So it's paid for, it's ready to go. We can't wait till we gather. But in the meanwhile, let's look at the agenda. We know we kind of moved in a little bit on your lunch, but let me give you some directions here. And we have a couple of more Amazon gift card prizes. So hang on just for a few more minutes, please. So right now we're going to do lunch, and we're still going to come back at 12:30. So sorry, change. You get to have a half an hour lunch. And then we're going to go do job alike breakouts. Do you guys like I did a first then card? So the job alike breakouts mean get your agenda. And if you're in family support, you're going to click on that when you come back from lunch and go to your own special world with your family support agency people. And regional centers, you're going to go to your agenda and click on your breakout group in your special Zoom meeting link. But schools, everybody come right back here. Don't do a thing to your laptop except wait. And then we're going to have a short presentation for you to get you all set up. And then you will go to a separate link that will take you to your captain region job alike group. So all 17 captain regions will be joining a Zoom link. But at 12:30, come back here, schools, and family support and regional center, go to your links. So when you get to the regional center and the family support breakout, take a fun or funny photo of your whole job alike group, and your leader in that group will have directions on how to do that. You guys are doing a great job. So take a look at the Facebook and the Instagram pages. You guys are just really submitting lots of really fun pictures. And so keep up the spirit. Schools, you'll do that when you go into your 17 captain region breakout groups. So now it's prize time. Heather, are you ready?
I'm ready.
Okay.
There's competing rewards with lunch and Amazon gift cards. So let's just do it. Boom. Shannon Romo. Woo! All right. You'll get a gift card in about 15 minutes.
Heather, we miss seeing you in Captain America.
You know, that costume
next year, right?
It's stored very well. It's in mint condition.
Okay, good. And I know you've been running, so you're gonna look good.
All right, last one is Irvin Shannon. Yay. Thanks for playing, everybody. We'll see you guys after lunch.
Thank you.
Bye.
Just a reminder that we're going to spend probably about 30 minutes all together here in the webinar. And then you guys will be logging off of this Zoom link and logging in with your actual teams for some more in-depth discussion and planning and conversing. So just a little bit longer in terms of presentation, and then you'll have your opportunities to do some sharing and discussing.
And just a reminder, if any of you are part of the Regional Center cadre or the Family Support Agency cadre, you should not be on this link. You should go to your agenda and go into your very special Zoom links just for your Job Alike group. So now's your chance to kind of get out of this one, go to your agenda and find your other private Zoom meeting with just your people, your Job Alike folks.
All right, so let's go ahead and jump into this afternoon's Schools Job Alike presentation. We have three major things that we want to cover with you all this afternoon. We're going to be looking at the principles of highly effective training and coaching, and working with you all to figure out how to apply these in the virtual context, which it appears that we're going to be in for at least the foreseeable future. We want you guys to consider some ways of continuing to promote and support the use of EBPs for autism during distance learning. And we want you to be able to meet within your regions to start having some conversations about how you might be able to do this using webinar and doing e-coaching and maybe holding some PLCs, but to really, sort of take advantage of this virtual opportunity that we have for some collaboration and coordination across the regions. So a reminder that the people who nominated you to be part of Captain, your SELPA directors, considered the following when they selected you. Number one is your commitment to do training and coaching, to regularly consult with or train others on EBPs for ASD, and your ability to carry out the requirements of Captain. And these requirements continue to apply even in the virtual context that we find ourselves in, although it does require a little bit of a shift in how we're doing things. And it's going to be important that you guys meet with your directors and the people who nominated you and share with them your ideas and plans for how to make this shift. You guys saw based on the survey results that the majority of you, over 60%, said that the need for EBPs actually increased with COVID, didn't decrease, but actually increased with this virtual situation that we find ourselves in. So the need for us to really figure out how to pivot and to continue to provide this support is pretty clear. So the requirements, again, just to kind of remind you guys, are to provide information sessions for your SELPA on autism and an overview of those evidence-based practices, to provide 3 high-quality training workshops on specific EBPs, and those can be EBPs of your choosing based on the needs assessment or whatever you determine is the need for this year, to provide implementation coaching for 3 teachers or programs within your SELPA using the implementation checklist for coaching, or to train 3 additional coaches on the MPDC model for training and coaching. So we developed this new, this SELPA Director Cadre check-in form. And it's a fillable PDF that's available on the Captain website that really should help to guide you in these conversations with your directors. So it's basically allowing you, to describe how you're going to do your overview training, who the target audience is going to be, how you're going to do your EVP trainings and who the target audience is going to be, how you're going to conduct your coaching and who your target audience will be for that, and whether or not you were able to complete all of your Captain Cadre requirements. And then we've provided down here at the bottom, if you look at the bottom right, under discussions, what barriers prevented you or can you imagine might prevent you from being able to complete the cadre requirements for the coming year. I do see a question in the chat, Anne, about how someone logs on to the regional center group. Got it? Okay, great. So really take this form, print it out, schedule a meeting with your director, whether it be your director of special ed or your SELPA director after the summit, and have a conversation about how this can look in this new virtual climate. And hopefully you'll walk away from today's session, this afternoon session, with lots of ideas and with some plans for how to work with your colleagues within your region about how to do this. And then don't forget, we're also providing you with a training in December on how to do e-coaching. So reminders that high quality training and coaching practices are really our current mission and our current goal. It's what we're really striving hard to do. And so these are all things that have been supported by research and by adult learning principles. So when you're conducting a high quality training, we want it to include a pre and post knowledge assessment. And the purpose of that is to really see if the training increased the participants' knowledge and whether or not you were successful in helping them learn the content that you were presenting. So it's our way of really kind of checking ourselves. Was I an effective trainer? Did I convey the information in a meaningful way? Or do I need to figure out how to adapt my training? Or do I need to figure out how for certain individuals to provide them with a little bit different format or different means of engaging them with the content and the information? High quality training also should include embedded practice with feedback. And embedded practice with feedback when you're live might be them actually role playing or practicing a skill. It's going to have to look a little bit different when you're online, we realize that. But it could be practicing how to, if you're doing task analysis as your EVP, how to actually map out and write a task analysis. It doesn't actually have to be a role play or a practice of how they would be implementing the practice with a student. Showing live or video demonstrations. Video is entirely possible and accessible when you're doing training via webinar. And then facilitating planning and discussions. And that was one of my big takeaways from the keynote this morning when Dr. Cook talked about that opportunity to really start to plan and map out your next steps is a true indicator of motivation. And getting ready for that next step is a great way to be able to sort of launch into the implementation phase of things. When we're talking about high quality coaching, the things that we're really looking for is the use of those fidelity assessments, those implementation checklists, and you guys go engaging in those coaching cycles where you're providing the recipients with reflective feedback and where you're linking the implementation of the practice back to the student behavior change, the student data. So that requires that you're doing some observation of the person implementing, doing the implementation. And that isn't impossible in a virtual situation. We're going to talk you through some of the ways that you might be able to do that, and you'll learn even more on our December workshop on e-coaching. But these are all expectations that we have of you, whether we're in person implementing our Captain requirements or in this current virtual world. And I don't have to remind you guys at all, I'm sure, of the reasons why we do these things. We want to get to that 95% level of implementation. And if we're just listening to people talk, there's zero application. If there's demonstration, there's still zero application. If there's practice, we get a little bit more, but it's really when we start to engage in the planning and the data and the coaching that we get things happening with students. So When we think about delivering this content and meeting the requirements in this virtual situation we find ourselves in, webinars can be information sessions. They can be where you're just disseminating information, but you can also design them in ways that actually meet that criteria for a high quality training and workshop. So when you're doing what are EVPs, that's an information session. It's disseminating information, it's raising awareness, and that's great. For that requirement, that's what we want you to do. And that can easily be done in a webinar sort of context. When you're doing those trainings on specific evidence-based practices, though, we really want you to be thinking about how to design them using those high quality adult learning principles. So those are illustrated or highlighted again for you there. We have provided some updated resources to support you with information sessions, both now and when we return sort of more of an in-person method of instruction. We have a new tab, and Anne pointed it out a little bit earlier, information PowerPoint presentations. And these are available for you to be able to use, but we also have pre-recorded some of them. So what are EVPs for families? This is a webinar that we conducted for the Family Resource Center. And it is video recorded. So that's something that you can disseminate and meet that requirement in that way. As well as some that were specifically around how to use EVPs for distance learning. So check out that new tab and look at those new resources that we've provided for you. And by the way, they're all updated with the latest NCAPE EVP information as well, and in English and in Spanish. And then we mentioned earlier also that we've developed the PowerPoints for the 10 most commonly trained evidence-based practices. And those are available as PDFs on the Captain website. What you're going to find in each of those 10 EVP trainings are these prompts. So these are sort of those cues that we've put in there for you guys as the trainer to remind you to do all of those adult learning practices that we know work really well. Whenever you see this little icon, let's practice, it's an opportunity to do some kind of engaged practice, and there'll be recommendations for what you do to practice depending on the evidence-based practice that you're training. Discussions, you'll see this symbol, the little think, pair, share, and then there's some discussion questions or opportunities for members of your webinar to be able to dialogue through the chat or through a breakout room. And then we have embedded videos. We've put links to the Affirm videos in the trainings where we think that they fit as a nice illustration of what's being talked about. So those are all pre-selected. You don't have to hunt through or fish through for the right video segment to embed. They've all been embedded for you. And then plans for next step. We've got all of the implementation checklists, and the pre-planning components of that could easily be an activity that you do to plan for the next steps. We also have pre and post knowledge assessments, and we've done those for all 10 of those EVPs that we've posted. And they're short, they're like 5 questions, and they should take less than 5-6 minutes to be able to take. You can send them out in advance of the training for the pre-test, and then have it happen right at the end of your webinar. Sending a link or doing a post of the link at the end of your training. But we wanted to just show you, let me see if this is going to work quickly, what these pre and post tests look like. So I'm launching one now. Oop. Doesn't look like it's going to let me share. Yeah. Oh, there we go. Maybe now. Yes. Persistence is the key. So this is what the pre and post tests look like. And you can see that they're done in a Google format. So the participant would just go in and enter their name, the name of the person providing the training. So that would be you or your team, the date and the month. This one happens to be on task analysis. And we've taken 5 questions from the content of the training. Some of them are multiple choice. Some of them require them to read a scenario and provide an answer, but it's 5 very brief questions about the core concepts of whatever that evidence-based practice training is. We also asked 2 questions around their confidence and competence. So what other trainings have you received on this, and what's your level of confidence taking this information and implementing it? So that gets to some of those, a couple of those key questions that Clay was talking about in the keynote in terms of feelings of self-efficacy. We want to know whether or not, as a result of the training, they have any sense of being able to go out and use it and do it. We also have developed the pre-planning checklist for designing evidence-based practices for professional development. And this is sort of our own fidelity checklist that we want you guys to be using and that we use before we do any training. So this has the steps that include all of those highly effective practices, and then a place down at the bottom for you to summarize the results. So were there any commonly missed questions? What was the average pre and post test score? Is there any reteaching that needs to be done with any of your participants? And are there any revisions needed the next time you conduct that same training? So those are all available. The PowerPoints are all available on the Captain website. The pre and post tests, however, are a little enticement for you guys. We are working on trying to establish a way of being able to keep track of all of this data. And so we've developed all of these through Google, and are proposing that we do a little bit of a beta test on using them this year. And so we're reaching out to all of you to ask if you would like to be part of the beta test on the pre and post knowledge assessments. And I'm going to have Tana Holt, who is one of our research assistants, who's been very instrumental in developing these training resources, walk you through the process for accessing the beta test. And she'll give you really specifics, but this is also available in the resource folder if you would like to go there and look more closely at the steps of this procedure. So Tana, will you walk us through the procedure for the beta test?
Yes, thank you, Patty. Could you please click on the training request form, actually right before that? Perfect, thank you. So again, in an effort to support these high quality training practices that Patty has been discussing, we've developed a package of online resources for those top 10 most commonly trained EBPs. So our hope is to provide training resources that can be easily accessed and shared by cadre through this Google Drive platform. So for those of you that are interested in participating in the beta test, what you'll do first is email our captain@marinschools.org email asking for this training folder request form. So this request form, you will enter your name, and then we'll ask you for a little bit more information about your captain region, and then when you'll be doing an EBP training. And then here at the bottom, you're going to indicate which EBP training resources you would like to receive. So we have these top 10 resources, and then that will get submitted to us. And then we will be creating a personalized folder for you guys with these loaded resources. So if we can go back, Patty, and then go to the other presentation. Perfect. So I'm going to kind of walk through the logistics of accessing and sharing these resources on our Google Drive platform. And again, I'm going to go pretty quickly through it, and we will have these slides on your participant folder as well. So once you submit your request form, you'll get this email invitation, and it'll prompt you to open up your personalized folder. Next slide. So your folder will be loaded with the following 4 training resources for each EBP that you requested. So in this example, the cadre requested resources for a training they'll be doing on antecedent-based interventions. So they have the brief packet from the Affirm modules. They'll have the pre and post knowledge assessments, and then a training PowerPoint for antecedent-based interventions. Next slide. So based on your preference, you can view your training resources as tiles, as you saw in the previous slide, or as a list by clicking that top right button. And the list view is just expanded, so it allows you to see the whole name of the file. Next slide. So these pre and post knowledge assessments, as Patty had mentioned, are those resources that will allow you to engage with your trainees. And as the name suggests, they're there to test their knowledge on the particular EBP that you'll be training on before and after your trainings. So to send these assessments, you'll select the one you'd like them to fill out. Next slide. And then you'll be directed to this editable view of the assessment. So we don't want to edit anything, but you do want to send it to your trainees. So you'll go to that purple button in the top right corner. Next slide. And you'll be able to enter the emails of the trainees you'd like to take this assessment. And you'll even be able to put in a personalized message, kind of reminding them about the training or when they need to have it done by. And then you would send it. Next slide. Thank you. So once the assessment is sent out, you'll be able to review the responses you received in either a summarized view or a raw data view. Next slide. So to access the summarized view, you'll again click on the assessment you'd like to access, and you'll go to the responses tab. So as you can see here, this person already has 3 responses for this assessment. Next slide. So then you'll be directed to the summarize view, which will then allow you to look at your responses in an aggregated view. You can look at it by question to see which ones people miss the most, or to see what people really do understand, or you can look at it by individual. So you can do that by clicking these tabs that are at the top in the red boxes. And then the data view, for those of you that prefer using Excel, can be accessed through the same responses tab, but this time you'll also click the green Excel spreadsheet button right there to the right. Next slide. So you'll keep that create new spreadsheet option selected, and then you'll click create. Next slide. So this Google Excel sheet will pop up and it'll have all the raw responses. And now this response sheet will also be loaded into your personalized folder, so you'll be able to access that when you need it. So just to recap, we want to encourage anyone that will be planning any EBP trainings coming up to request a resource folder and use that request form, and to help beta test these resources. So we do want to stress that since you will be given editing access to these resources, please do not edit any of the resources that have been put together by your regional implementation leads and research staff, and to please follow the sharing instructions from these guidelines so that your trainees are also not able to access editing these resources. Next slide. So we hope many of you can participate in this beta test. Again, to request a folder, you'll need to email captain@marinschools.org with the subject line, need training materials request form. This can be done after the summit. Please allow at least 2 weeks for your folder to be loaded. And then any questions or additional instructions you need or you think would be helpful, you can also email the captain@marinschools email. And these slides, like I had said, will be available in the training folder that will be sent to you. And they're also available now in your school's Java-like participant folder. And that's it.
Thank you, Tana. So it's not mandatory, it's not required that you participate in the beta test, but that's how you will get access to that training package, which is the actual PowerPoint, the pre and post knowledge assessment, and then the brief package from Affirm. If you choose not to participate in the beta test, you can still access the PDF of those PowerPoints through the Captain website. But this really will help us to be able to know, number one, if this sort of platform is going to work. We'll also probably towards the end of the, sometime during the spring, we'll be sending those of you who participate in the beta tests a questionnaire to give us some feedback on how things work. And it'll also give us an opportunity to test the questions on those quizzes to see if they really are getting at some of the core content that we're hoping participants will be learning. So thank you if you decide to participate, and if not, then just continue accessing the resources through the Captain website. So getting the most out of professional development, we know really has a lot to do with the coaching and mentoring. So we've developed this implementation checklist for coaching that walks through the process and all of the steps and components of doing high quality coaching. And we want to encourage you guys to really start using this as a self-check, but also to ensure that, that you're following all of those principles and practices of high quality coaching. E-coaching is a method of providing coaching that's delivered over an electronic format. And the goals are the same as they would be if you were coaching someone face-to-face. It's to improve the trainee's use of an EBP. It includes pre-observation conference, observation, post-observation conference, and the use of reflective feedback, just like you would do in a typical face-to-face model. When you're doing e-coaching, your observations of the implementer can be either synchronous or asynchronous, which means that you can be actually on their Zoom call watching them implement a practice, or watching them via video technology in the classroom live as they're doing it, or their teaching session, the use of the EBP could be recorded and you're watching it at a different time and then providing them feedback at a later point in time. Research has supported both of these methods as being effective, and it has supported e-coaching as being as effective as live in-person face-to-face coaching. There is, however, a difference between coaching and consultation, and we hope that you guys kind of picked up on that in this year's survey. We tried to make the differences really distinct so that you would really be able to self-evaluate and self-assess which model that you are most commonly using. Consultation is really specific, and it involves us, the experts, the people with the extra knowledge, going in and helping to solve some kind of a problem. The expert is usually there to give their professional input or opinion on what's happening and what to do next. And it often involves some kind of direct observation by the consultant. And it may be cyclic, it may involve multiple visits, but oftentimes consultation is a 1 or 2 times sort of a circumstance. Coaching, on the other hand, is really designed not so much to solve a problem, but to build capacity. Where the coach facilitates learning of new skills through reflective methods, and the coach really supports the trainee in making the determination about next steps. Coaching does require direct observation, but you're more observing the implementer than you are the child or the end learner for the appropriate implementation strategies or the appropriate use of the evidence-based practices that you're wanting them to use. And coaching is always cyclic, and it involves pre-observation, observation, and post-observation, and usually requires multiple cycles in order to help a coaching recipient reach fidelity of whatever the practices that you're working with them on. Now, the logistics of e-coaching, they're gonna be a lot the same as they would be if you were doing face-to-face coaching. Some tips that we have are, number one, ask for volunteers. Always start with the willing, the ones who are really motivated and where the match has already been ignited and they're ready to actually do the behaviors. Don't forget to confirm the agreements and the roles so that everybody knows that this is not an evaluative circumstance or relationship. It's really a supportive role to help them to know how to better support their students. You might want to also, in meeting your requirement for coaching, consider whether or not you're in the role of being able to coach families directly. Now, remember, your requirements say to coach 3 teachers or providers. So the provider in a lot of cases right now is going to be a family member. So it could be absolutely appropriate that you're doing some direct coaching and supporting of families during this time. And helping them learn how to implement and be more effective with the use of evidence-based practice. And don't forget, you can still do implementation awards even if your coaching and support is happening electronically and your teachers that you're coaching are using evidence-based practices through distance learning. Anne went over some of the legal components and FERPA with e-coaching a little bit earlier. During the main session. But just a reminder that it doesn't appear that the e-coaching would be out of compliance with FERPA, but we do request that you check with your administrators and your local council to see what they advise you on about permissions to observe and that you follow any of the local requirements for permission to observe. Absolutely, if you're video recording sessions, there's going to be an extra layer of caution that needs to be taken and awareness and probably releases that need to be signed. One other thing that is a new tool that we're providing for all of you is a training and coaching planning form. And this is really designed to help you map out your training and coaching plan for the coming year. So it's a fillable PDF. It's available right now in the Captain Resources section of the website, and it'll allow you to really sort of map out who you're going to be doing your training and coaching with in this coming year. So what about PLCs? PLC is a professional learning community where a group of educators meet regularly, share expertise, work collaboratively to improve teaching skills and the academic performance of students. These are traditionally not conducted by an expert, but rather facilitated to support group learning. And it's different than group consultation or expert office hours. Some of the PLC time can be didactic in nature, where the group is learning a new skill or doing a module together and the discussing and making plans for it. But really, it's the whole idea of a PLC is for collaborative and connected learning. We encourage you guys to think about PLCs as an option during this time and really to think about how you might be able to coordinate them within yourself and maybe even within your regions. Some of the logistics and tips that we have for setting up and conducting PLCs, small group sizes with consistent participants can really help to promote a sense of communication and community and openness. So usually groups of between about 8 to 10 seem to work the best. Regular meeting times that are manageable, 60 to maybe 90 minutes, a couple of times a month, seem to be reasonable. It could be up to 4 times per month if you have, you know, sort of protected and strategic planning time already built within your calendars. Having a consistent structure, though, so there's consistent expectations, can be really helpful. So it might look like 20 minutes of sharing back from the previous session's learning, 20 minutes of new didactic learning, and then 20 minutes of discussion about how members of the group might implement or make use of that new learning. We actually piloted a PLC model just a month after COVID forced the use of distance learning. And we did it using a model called ECHO, and that's the Extension for Community Healthcare Outcomes. This is actually an evidence-based method for doing professional learning in a PLC type of a format where there's a hub and spoke, all teach, all learn approach. And the hub are the experts. So in this case, it would be like our captain cadre. And then the spokes are all of the participants who are wanting to improve their practice. We actually recorded the didactic portions of the ECHO that we did, and those are all available for you guys to look at, make use of, and consider as part of your professional development offerings this next year. All right. Don't forget about all those other resources that have been pre-recorded. The Padlet has a wealth of resources and information that you guys can consider in terms of using for professional development in the next few months. And that's available again in both English and in Spanish. And you can access those right there at the very top of the Captain website. So this is our call to action for you guys, and this is what we want you guys to spend the next about hour and a half, no, the next hour, really doing is getting into your regional groups and talking about how you're going to meet the needs of your teachers and your providers during this sort of distance phase of the year. How can you work together to provide high quality training webinars during distance learning? How can you provide high quality coaching during distance learning? And can you facilitate some PLCs? And if so, what might those look like? If you've already been doing that, we'd love for you to share what's been working for you, how you're doing it. But also look at this as an opportunity for regional collaboration. We don't have the physical proximity as a barrier right now. So if someone in your region's doing a webinar on visual supports, maybe everyone in that region could have access to it. Because we don't have to worry about driving there, and we don't have to worry about the number of people in the room. This really provides us with some great opportunities to really expand our regional teams and our regional offerings. So that's going to be the points for discussion in the breakouts. So we're going to ask you guys to go ahead and log off of this webinar now and join your regional webinar that is outlined on the agenda that is in the participants folder. And when you get into those groups, we also want you to do your fun and silly photos and post them on social media because we'll be able to see your faces. So go ahead and log off now, and we'll see you guys in those regional teams.